Albert. Good morning, folks and members of the task force. We'd like to welcome you to this, our first meeting of the Vulnerable Adult and Mental Health Task Force. Clarissa, let's go ahead and call roll if you would, please.
Good morning, Mr. Chairman. This is roll call for the Mental Health and Vulnerable Adult Task Force for May 24th. Senator Ballo.
Present.
Senator Nethercott. Here. Speaker Summers.
Here.
Representative Zwanitzer.
Here.
Director Johansson.
Here.
Ms. Marks. Here. Deputy Director Babbitt.
Here.
Mr. Brown.
Here.
Ms. Butler.
Here.
Co-Chairman Baldwin.
Here.
Chairman Larson.
Here.
All are present, Mr. Chairman.
Thank you, Clarissa. Thank you, staff. There's a couple of house cleaning items we need to take care of at the beginning. Those of you that have already been to your first interim committee meeting will be familiar with this, but we just have some decorum that we expect the committee to comply with, directing your comments through the chairman and acknowledging that. Likewise, for those of you who may be presenting, that your comments will come to the chairman, then back to you through the committee members that you're asking questions to. I think everyone here is familiar with that process. External or unsolicited comments from the public will not be tolerated. We'll keep this all in line and make sure that we show respect for the opinions and thoughts of those who are presenting to us today, and from those comments made by public agencies and the committee. Next, I would just acknowledge, this is Friday before Memorial Day, and here we are, and Senator Baldwin just got back from Houston a night ago. Senator Nethercott's been in committee meetings 2 days earlier, I believe, this week, and along with, our agencies are busy. Senator Barlow was going to come down this morning, come down last night. Just appreciate the dedication and the sacrifice that you've made. Likewise, there's been a lot of preparation go into this first meeting from Department of Family Services, Department of Health, our judicial system, as well as Department of Education. Thank you. I think for this committee, for this task force, to be able to get something concrete, particularly out into the stand committees on time, we're going to be doing a lot of work in between meetings and formalizing it on our meeting dates. So thank you for that effort so far. I would just share with the committee members and those of you who are here from the public that the majority of our focus during this interim is going to be on the vulnerable adult statutes and vulnerable adult services, and finishing up with the conversation that we started last year, and then to further refine and have a more in-depth conversation on how we provide mental health services in our K-12 system, whose responsibility it is and what role the districts have to play in that, and what services are available, and how those play out. We'll hear updates on the other two issues, which is our diversion program from the courts. That pilot program is going to be going through this year. We'll be in Gillette to tour the facility and to look at the program later, but we're not going to be spending a lot of time until we get the results back from the pilot program. Likewise, with our adolescent kids with high behaviors, we're looking at trying to establish a pilot program for a limited number of those to further identify what we do and don't know. And so we won't be spending a lot of time on that topic until we get the results back and have a little further recommendation. We're also going to be getting an update today from Mrs. Butler on treatment courts. We've got 2 bills that we're going to consider language for today that we can pass on to the standing committee, which will probably both go to the Judiciary Committee if the chairman are willing to take them, and that's on treatment courts and confidentiality. We will look at those today. If we have to amend them, we may do the final vote on them if we need be in our June meeting on the 13th. So with that in mind, any comments, Mr. Chairman, before we get started? So we appreciate Ms. Marks being here with us today for the Department of Family Services in place of Director Schmidt. She's put a lot of work on and moving forward today. So Danielle, if you wouldn't mind taking us through our first bullet, which is the conversation on the confidentiality statutes and how that plays into the consideration of this task force and what it is you're trying to get accomplished. And then we'll have LSO take us through that draft.
Thank you, Mr. Chairman. And thank you, task force members. My name is Danielle Marks. I'm a senior policy advisor at the Department of Family Services, and I'm happy to provide a brief overview of our interim topic request regarding DFS confidentiality statute review. You might be wondering why this task force. So for the past 5 to 10 years, the legislature, including many of you, have come to the agency with questions regarding how our youth and our vulnerable populations are served across systems. And both within our agency, there are systems within our agency and external to our agency. For example, we've heard questions about CHINS, children in need of supervision, the high needs youth that we'll talk about later this afternoon. And in the past, we've had to say we can't look at that data. We can't provide summary of services, outcomes for children and youth who are served by multiple systems, mostly because of our technology. We are proud to say that our agency has since focused a lot of time, effort, and investments, many of which this body has supported, in modernizing our IT systems to be able to answer questions about the individuals our agency serves. With that success in mind, we then turn to what other barriers exist for sharing data within and external to our agency. In consultation with our AG, we identified some statutory barriers for sharing data, both internal and external. And that's essentially why we're coming to you, the task force, to help us strike a fair balance between the need for data to answer key program evaluation, research questions, policy questions, while also maintaining the utmost privacy of that data that we maintain and protect across systems. We have a couple projects and mandates that we believe these statutory changes will help us meet and pursue. Mr. Chairman, would you like me to provide a couple examples of the reasons why we need this statute change?
We would, and then let us know when you're ready to have staff take us through.
Thank you, Mr. Chairman. Specifically, one of our federal mandates when it comes to IT modernization relates to our child welfare case management system. So we currently use a very antiquated, outdated child welfare case management system, as you know, YCAPS. And that's the investment I spoke about earlier. We received a budget of $26 million, 13 million in federal funds and 13 million in matching state general funds to modernize this system. This system federally is required to establish bi-directional data exchanges, and we believe this statute change will enable us to meet the minimum requirements of the federal law, as well as build a system that can answer better questions about the individuals we serve and the outcomes of those individuals we serve within our system and across systems. Second, we are active partners with the Department of Health and others regarding behavioral health redesign. And we have entered a data use agreement with the Department of Health to share key data to help evaluate the outcomes of behavioral health design. Current statutes prevent us from sharing that data at this time. So behavioral health redesign is another use case for this statute change. Additionally, our agency is very interested in understanding the trajectory of kids before they come to DFS and after, and ultimately their outcomes. So the state has a statewide longitudinal education data system. This is housed with the Wyoming Community College Commission, and we are part of the governance structure for the SLEDs, which is the term that we often use to refer to that system. But currently our statute limitations prevent us from sharing data, and thereby limiting the types of research questions that system might be able to answer in the future, including questions of this legislative body. So that's another use case. And then lastly, I'll share that internal to DFS, we operate and manage a variety of programs that help keep families safe at home and provide opportunities for success. Statute barriers do limit data sharing within our agency. So for example, a child who's exiting care, exiting foster care, might be eligible for services from our economic security programs because of their experience in foster care. And currently we can't share that data across systems to streamline the referral and eligibility for those youth that exit care. We can walk that youth down the hall and provide a warm handoff, but we believe the technology will support more streamlined service delivery. And that's another solution that we're looking for with this statute change. With that, Mr. Chairman, I'll take questions.
Representative Summers.
Mr. Chairman, thank you, and thanks for that review. So one of the hardest things I think, to get passed in the legislature is things that reduce confidentiality. And so a couple of questions. One is, what type of information are you sharing? And in SLEDs, it's very individual. I know that from my time on education. So it is an individual student that you're sharing information on. SLEDs has, as I recall, has some confidentiality built into it. In other words, it has safeguards built into that system. So I'm fairly comfortable there. I think we can make that case. But if it's aggregated data, that's one thing. If it's a lot of individual data, then how are we going to ensure that data is protected? And how do we get over the hump in the legislature, I guess, of ensuring that that our colleagues understand that? So really, what kind of data are we sharing? And what's your thoughts about how we make sure that data is not compromised? Thank you.
Danielle.
Mr. Chairman, Representative Summers, thank you for the question. As LSO will describe, the statute changes within Title IX, so the duties of the director, and then there's conforming amendments that tie to other statutes that govern data use across our programs. So we could have a discussion and appreciate the direction of the task force in terms of what data we should be sharing, but it points to child abuse and neglect records, juvenile justice data, children in need of supervision, and it also points to APS, Adult Protective Services data, as well as some public assistance programs.
Mr. Chairman, I guess, would you envision sharing individual people's data or aggregated data? So in this whole system, what data are we sharing? Aggregated, individual?
Mr. Chairman, Representative Summers, I think our hope is to establish rules that establish safeguards to require the minimum level of data required to answer a research question. The truth is that for longitudinal analysis, there is a level of identifiable data that is necessary to link individuals across programs and across time. But that's where that comment about safeguards comes into play. And we are part of SLEDs, and you mentioned some of those safeguards, and we're used to kind of witnessing the operation of that governance model with SLEDs, even though we do not share data. So we are expecting that if this statute change does move forward, and if the department promulgates rules, that it would outline some of those governance guardrails and define the types of data, aggregate or otherwise, that we would be using to answer key questions. And Representative Summers, that might be a "it depends" answer, but we are ready and willing to take the direction of the task force in standing up those guardrails and working within the limitations that you see are necessary.
Mr. Chairman.
Please.
Mr. Chairman, sorry. So I don't know what I don't know, right? So I'll rely on the good attorney here to maybe figure this out. But I think if DFS has a few of those guardrails that you can think of, that may be appropriate in statute and not in rule, right? We don't want to overburden the statute when you can do it in rule. At the same time, we want to provide confidence. And the other thing, so that would be one question. Do you have some of those guardrails in mind that might help us if we decide to go down that route? And then second, I could see like at a bare minimum, I hate to require another report, but at least a report of what kinds of data that you are sharing each year and what kind of safeguards you have put in place may help alleviate concerns as well. So anyway, thank you, Mr. Chairman.
Further questions? So Danielle, I think you're covering a broad swath here in this statute. And so we have, if I'm understanding correct, we kind of have procedures for SLEDs, but we task you this year to oversee through eKids the acquiring of this data on pre-K-12, pre-K information that then is somehow going to have to be shared, and so you kind of have those in there, but you're also in your child protective stuff as you have conversations with the Department of Education on individuals and for those services that might be court ordered, and Department of Health. You need to be able to have those conversations per the individual, which would streamline their ability to get those services sooner. Am I understanding that accurately? So it's not the same across the board, and you're going to have to address the concerns of Speaker Summers kind of per the action once we get this new system in place to replace YCAPS, how that looks versus some of the other places they belong. But it's not a one brush paints the whole thing. Is that accurate?
Mr. Chairman, I do think you're pointing at the complexity of our various systems and needs for this data sharing. I think that the rules promulgation, if this were to pass, would be a heavy lift because of those reasons. So it does touch on a lot of existing projects. You mentioned eKids, as well as your last point, I think, relates a lot to the work that the ICC does, or the Interagency Children's Collaborative. And that in particular, that statute does, of all the statutes, that statute actually does provide some limited data sharing for the purposes of co-case management of those ICC youth. But it is limited. So I do think, yes, Representative Larson, we will need to kind of narrow in the broad scope of the statute within rule and probably touch on a lot of program areas.
It's not, that feels like we need to identify those requirements in statutes, and or are we all comfortable with the rulemaking process, which historically we've done? I just want to make sure that there isn't some angst as we consider this statute that that we need to refine more, and we've got time to do that. But if there's concerns on the rulemaking effort, appreciate thoughts on that. So Dan, or Chairman's on.
And just a question, it's probably for an attorney as well, but if there are cases where we would have a concern, someone violates a section and it's a rule and it goes to a court hearing, do we need a protectionary reason to have it actually in statute for some of these confidentiality reasons? Would be my only concern. If it's in rule and there is some type of lawsuit or data breach, et cetera, are we better protected by having something clearer in statute to defend There's a rule in Reg NF.
Thank you, Mr. Chairman. I think probably the question is, who would we want to be held accountable for the possession and/or violation of the dissemination of the data? And so, assuming it's going to be an employee of a state agency, that would be a rule policy violation, right? That they could then be terminated for some type of disciplinary action associated with the breach. If you're wanting the public to be able to hold the state accountable, that's a different analysis altogether, which would require a review of the Wyoming Governmental Claims Act, which I would discourage us going down that road in light of the complexities associated with holding the state responsible for such action.
You say you would encourage us
To not go down that road.
Okay. Any other comments? Yes, Senator Barlow, thank you.
Thank you, Mr. Chairman. So I appreciate the discussion, Ms. Marks's overview of it. We're going to walk through the bill with LSO, and the reason I'm asking is because there were several comments that Ms. Marks made about, I think it was statutory limitations, but actually in this bill draft, there are no repealers and there are no stricken language. So I want to understand, and maybe it's from our LSO staff, where those statutory restrictions are, or at least I don't see any. Maybe I missed them. So while this is a authorization, I don't see a corollary reduction of where there may be limitations besides the federal law component, which this does account for. So anyway, and maybe, like I said, maybe it's for our staff to reflect on, not for Ms. Marks, or maybe it's a combination, but at some point I'd like to understand that. Thank you, Mr. Chairman.
Thank you, committee. With that in mind, Anna, I think, very good, Lucas.
Mr. Chairman, thank you. Luke Plum, LSO, here to discuss 25 LSO-0004. This one is Department of Family Services confidentiality amendments.
Luke, draft 5.
Oh, sorry, yes, it's working draft 5, yes.
Thank you.
Thank you. And just as a beginning note, everyone got another copy of this bill draft, handed out to them. I realized late yesterday afternoon that the packet, the one that was included in the packet was missing the section 2, which is the non-codified requirement that, the Department of Family Services promulgate rules. So the correct version of the bill was the one that was at your place when you came in this morning, but that's just on page 2. That was just my mistake. It didn't get saved correctly.
It's the one on your desk. Give us just a second here, Lucas. We're going to make sure everybody is using the one off their desk.
Yeah, it's just going to be on the end of page 10. I will get there, but it's just section 2, and it says that DFS shall promulgate all rules necessary to implement
And
provisions.
Lucas, I'm going to have you get a little more intimate with that microphone.
Absolutely. So I'm going to go ahead and jump back to the beginning of the bill draft. Got the title, and it does amend several sections of statute here to make conforming amendments. But the primary changes in Wyoming Statute 9-2-2104, and this is the duties and powers of the Director of the Department of Family Services. And this language was on the recommendation that Ms. Marks has gone through and for this change. And really what this does is it says that, notwithstanding any provision of state law regarding confidentiality, the director shall review the effectiveness and impact of programs and services, which shall include the sharing of data to the extent permitted by federal law. And then it provides the purposes for doing so. Yeah, thank you. I apologize, thank you. And so it provides the purposes that, including, individual case planning and decision-making, policy analysis, program evaluation, performance measurement, and participation in bona fide research and integrated and longitudinal data systems. And that was kind of the recommended part. After discussion with the chairman on this one, I did include a section that no person shall disclose any confidential information except for the purposes that are provided in this paragraph. And anybody who were to willfully violate that and share confidential information would be subject to a misdemeanor penalty and could have a fine up to $500. And so considering some of the previous discussion from the committee, I do have a staff comment on page 3 that really does kind of discuss whether there should be additional requirements on the sharing of confidential data and whether that should be included in statute for the purposes of who may receive the data. You know, if the committee or if the task force would wish to consider whether there should be written agreements or other processes within the rules to share the data, and any further confidentiality requirements of anyone who does receive confidential information. And as I mentioned, at the very end of the bill in section 2, there is just that requirement that the Department of Family Services promulgate rules. And as I mentioned, this is notwithstanding any state law regarding confidentiality, but just kind of as a, to cover the bases sort of thing, I did include the term, that confidential, this data may be shared to the extent permitted by federal law, just to match any requirements there. And so those are just some things to consider. The rest of the bill draft primarily is conforming amendments throughout, Title 14 regarding children, right, for things like the Child Protective Services, Child Protection Act, the Juvenile Justice Act, the Juvenile Probation, Children in Need of Supervision, the Juvenile Justice Information Systems, but then also it does go to makes a conforming amendment for the Wyoming Community College Commission for the statewide longitudinal education data system, as well as within the Adult Protective Services in Title 35, and then Public Assistance and Social Service Programs in Title 42. And so throughout, it just uses the similar language or references back to this, to that very first statutory change. And just essentially to allow the Department of Family Services to be able to share this information as they need to. And then the Department of Family Services, and so then on page 10 at the end, the section 2 that is included is that the Department of Family Services shall promulgate all rules necessary to implement the provisions of this act, and then the bill would be effective immediately. But with that, I'd stand for any questions.
Questions? Representative Summers.
Mr. Chairman, thank you. So one thing I really dislike is when it says notwithstanding any other provision of state law. I don't know what those provisions are. And yet we go through a whole bunch of provisions, so why don't we just tie it to those provisions? So that's my question, is why is it notwithstanding every provision of state law, but then we're going in and actually doing that in specific places? So are there other provisions that are not accounted for in this? And so why do we do that, and why do we not at least lay that out so we as legislators and the public can understand what we're doing? And then my second question.
So before you ask your second question, so just to make sure, so when you say lay that out, meaning make reference to those other provisions of law so that we would know where to look for them, is that right?
Mr. Chairman, yes.
Okay.
The bill draft does a really good job of going into several sections of law and adding in this provision of where you can confidentiality can be eliminated or reduced or whatever. And, but I don't know what the other provisions of state law that might be hidden out there. And then my other question was really on the federal piece, and maybe I missed it in my packet of information. But what are the federal standards for confidentiality? So can I lean on those? And maybe I could if I knew. I didn't take the time to look them up. But what are those federal provisions of confidentiality?
Lucas, I'm going to pass that over to you.
Mr. Chairman, Speaker Summers. Yeah, the language to say that, notwithstanding any other provision of state law, I can't tell you exactly what all the other particular laws regarding confidentiality are within statute. I was looking primarily in terms of this bill draft. And it does go through and make all those conforming amendments. I think certainly if it would be the wish, we could say notwithstanding the confidentiality requirements of these various statutes, that is certainly an option. This was just kind of slightly simpler way to do it, but that is an option, and there are certainly, I believe, other confidentiality statutes throughout, but this one is just focusing on those that would be touched upon by the Department of Family Services. And so that is really just kind of the primary way to do that, and the limitations on federal law, the Department of Family Services may be able to better answer that question, slightly. Some federal programs allow for the sharing of confidential information, if it's a legitimate state purpose, is often the language that's used for these grant programs that I've, kind of identified at the end of my staff comment on page 3. But certainly there are other federal confidentiality rules that would, that a state would have to abide by.
Thank you. Danielle, would you like to enlighten us a little on that if you can?
Chairman Larson, I think that at this point, we'd be happy to do an analysis of those federal standards regarding confidentiality. I don't have a lot of that information available right now, but we'd be happy to get back to you.
Mr. Chairman,
Please, Senator Nethercott.
to the representative's question, I think that the specificity you're seeking is unattainable and not prudent to pursue due to the changing dynamics associated with confidentiality and the type of data. I think, and I'd let the department correct me, there's a variety of areas of information that would be considered confidential associated with the records of these children. You have health records, right? So you have health-related laws, confident, like HIPAA, that would be applicable concerning health records associated with their files. Education records, so you have like FERPA at the federal level that may be in these files. You have criminal investigation information that may be confidential, subject to the status of those criminal cases with abuse and neglect or juvenile delinquency. So I think it's a broad swath of areas of law that could be triggered when discussing this population's information. And so I think it's important to recognize it's very broad and numerous, quite frankly.
So as we work the bill, we'll leave that conversation open for possible amendments if members of the task force feel that that's warranted. Further, Representative Summers, anything else? Senator Barlow.
Thank you, Mr. Chairman. So in the context of that and what information, I think when we look at the purpose and this statute, and it's very distinct, and I don't know if it's broad enough or if it's too overly broad, but I read it as two different things. I read it as individual. This is on line 16, page 2, Mr. Chairman, sorry. Purpose of individual case planning and decision-making. And that would be very granular information about an individual. And then the rest of it I read more as broad programmatic successes or opportunities or et cetera. So it does pose maybe some of the uniquenesses that we're trying to understand here is what the limitations are. Aggregate information, does that have the same limitations as individualized, to Senator Nethercott's point? And I think maybe there's at least a discussion to have, and maybe Lucas can point us to this, that we actually segregate that a little bit. We say, look, programmatic review things have maybe different, anyway, I'm just trying to tease this out, because some of this is a child longitudinally following that. Some of this is program performance over time, the broader program, and how do we actually understand what we're trying to do? Where is our priority? Certainly we have the priority as the child or the individual having success and having the right resources, et cetera. But how do we understand, can we dive down to such a granular level that it exposes too much of an individual, whereas we could maybe get almost as good information if we did something more step back a little bit. So anyway, I just throw that out there, because when I read the purpose, if that's the purpose, first of all, that's the only purpose it can be used for. If we're going to make this statutory, you don't get to use it for anything else. So, et cetera. So we better make sure we like the purpose. and limit or expand it one way or the other. So anyway, I just throw that out there, that even within these few words, these couple lines, there's really, I see two different sets of potential information and the use of it. Thank you, Mr. Chairman.
Follow-up, anyone? So a question that I had, Danielle, was this sharing of data will go across agencies, but the rule promulgation really is in the Department of Family Services. And so does there need to be some coordination that those rules are applicable in the other agencies that are impacted as well? How does that work?
Chairman Larson, I'm going to look to Director Johansson to see if he has any input as well, but certainly we would take our requirement to promulgate rules ourselves, but I do think you bring up a question about need for coordination across other rule promulgation for other agencies.
Well, and thank you, and Stephen, Director Johansson, before I get to you, it seems that if we adopt rules, they ought to be found in each of the respective agencies, perhaps somehow, and there ought to be some coordination. So Director Johansson, if you'd maybe share with us your experience a little bit.
Thank you, Mr. Chairman. From the Department of Health perspective, obviously can coordinate rule promulgation, and we have many shared clients, potential and current interfaces with systems where we would exchange data if this bill were to pass. It's important to note that with a few exceptions in the Department of Health, our entire agency is a HIPAA-covered entity, so we're, as a healthcare entity, kind of held to one of the highest standards of privacy and security, both by federal and by state law. So once any information from Department of Family Services enters the realm of the Department of Health, or we receive that data, it now becomes part of our covered entity, and our privacy and data security practices must apply. That involves things like physical space security, which we have in the Department of Health, business associates agreements if there's a data vendor or a system vendor that's running that data system, where they have to assure and attest to various privacy standards, and then our own network security if things are internally hosted. So once any data is shared with the Department of Health, it becomes part of our covered entity status and kind of raises to that threshold. In terms of rule promulgation, we'd absolutely work with DFS on making sure that those program areas, whether it's on the Medicaid side or the Behavioral Health Division, Behavioral Health Redesign side, would be coordinated. But it would, for us, if we're seeing or receiving that data, would in many cases be held to a higher privacy threshold. And I know it's a little bit different with the Department of Education under FERPA standards, which we also adhere to in our developmental preschools, but more than happy to coordinate rule promulgation and make sure, for example, in Behavioral Health Redesign, which is our big reform that's turning on July 1st, should this bill pass and more data exchanges happen on those very narrow but important priority populations, our rules would align, and we could make adjustments if need be. Our rules in Behavioral Health Redesign would align with what the DFS privacy or security standards would be.
So I guess kind of the question I'm getting at is just as we develop this, so rules have an opportunity for public input and comment, and so if they impact populations primarily served by the Department of Health, but now would be impacted by a rule change in Department of Family Services, they'd be able to look at Department of Health rules and see that similar rules apply. Is the coordination or the collaboration I'm trying to understand, and if that happens naturally, so be it. If that's something that we need some language we need to put in the bill to say impacted agencies, I'm looking for direction there, but we just don't want somebody to say, well, I looked in Department of Education's rules and it wasn't there, and how was I to know that I need to look someplace else?
Mr. Chairman, if I may, there's some recent precedent for this in legislation, both in Behavioral Health Redesign, plans of safe care for infants, where legislative direction to ensure the appropriate agencies coordinate the rule promulgation process. I think that would be appropriate here, and we're happy to do that.
You got that note, Luke? Okay. So any other questions or comments before we take a look at this bill?
You're going to go to public health.
Oh, public comment, thank you.
Mr. Chairman, if I could.
Yes, please.
A quick question would be then on the rulemaking, the way the bill is currently drafted, and I know this is all subject to change, it's effective immediately with required rulemaking. That generally means you have to implement something you don't even have the rules on. So generally, we have some kind of a time period where you can promulgate rules and then an effective date sometime in the future, et cetera. So I just throw that out there, not that it's important to the context of this or the conversation, but when we get to working the bill, I think there needs to be at least a discussion about what kind of timeline we're talking about for implementation as we go forward. So thank you, Mr. Chairman.
Any other public comment? Do we have anyone from the public that'd like to speak? Okay, with that in mind, I think that's, do we have a motion on the bill? Okay, second, so move the bill, and there's a second. Those in favor, say aye. Aye. Those opposed?
You gonna do amendments first?
We are, we're just moving the bill so that we can do it. So I'd like to walk through the bill and consider any amendments. And in committee, what I think we'll do is give these amendments to and adopt them and give the staff a chance to implement them, and then we'll reconsider and vote on the bill in the next meeting, just in light of time and everything else that we have going today. So starting on page 1, anything, page 1 or page 2?
Mr. Chairman.
Please, Speaker Summers.
Mr. Chairman, it'll be defeated, but I am going to make a motion, and I'm just going to do it in generalities and let staff figure it out. But basically, the only provisions of confidentiality that I want as a part of this are those that are cited in this act. So that would be my motion. To limit this, notwithstanding any provision of state law cited in this act regarding confidentiality. But that's probably not the right way to write
That's
it.
a motion. Do you have a second for discussion?
I'll second it.
Second discussion, Senator Barlow?
Mr. Chairman, so I want to be clear. Right now, we're talking about state statute.
State
This
statute.
is WS, this is not federal law. This is just the state statute side. Okay. Thank you. I'm just not going to support the motion, but I just wanted to clarify. Thank you.
Okay, any other comments? Okay, so we've got a motion on the table. Those in favor and support of the motion, and we would let the speaker work with LSO and the department to figure out what those are. Those in favor of the motion, say aye.
Aye.
Those opposed, nay? Nay. That motion fails. Next, or anything else on page 2? Senator Barlow.
Thank you, Mr. Chairman. I think that one of the challenges is I don't know that some of what is being referenced in this bill is actually the confidentiality statutes. And so I think that there is a value in maybe for the next meeting, actually having a reference of what confidentiality may be impacted to the extent they can be identified by the department or by other departments, to have that list. Because I understand what the good speaker is trying to get to. I just don't think that all these other statutes are probably the ones that actually need to be referenced. There's probably some other principal ones that need to be referenced that are confidentiality. This is about data sharing per se. So anyway, I just throw that out there that if the chairman so desire, I think we could actually maybe ask a little bit of research between the agency and the LSO to say what actually would be impacted by this. And then maybe it's much more refined if there is a subsequent motion by the speaker. Thank you.
So Clarissa, if you put that on our to-do list, and I think it just come back to you, Danielle, anyway, so.
Mr. Chairman,
Yes, please.
and maybe just for the task force's edification on the the brief that the Department of Family Services prepared, most, but maybe not all, and so I think it's a good question for LSO and the Department of Family Services, are referenced on the bottom of page 2 going into page 3 of the statutes that you see cited throughout this that have amendments in them, and what section of either Title 14 or Title 35 are in there. Ms. Marks, is that accurate?
Danielle?
Mr. Chairman, Director Johansson, if I understood your question correctly, there is not a direct match between the brief conforming amendments and the statute, and I would probably invite LSO to comment on the additional conforming amendments that were put into the bill draft, and then I'd be happy to comment afterwards.
Yeah, in light of the time, I think that we'll just gather that information on the referred documents and provide that as an additional as we prepare for the next meeting, okay? Okay, we're at the bottom on the bill, we're on page 2. Any other changes on page 2? Moving to page 3.
Mr. Chairman, page 2.
Please, Senator Nethercott.
Thank you. I find it curious that we're putting a misdemeanor crime in Title IX. And question for LSO of how many of our criminal statutes are located in statutes other than Title VI? And if it wouldn't make more sense to have a specific misdemeanor crime associated with the disclosure of confidential data in general, and that would be located in Title VI. So it wouldn't just be this statute, but it'd be this statute and all the others concerning violation of, or the intentional disclosure of confidential information. So conversation about creating a new crime in Title IX.
So I think that's a great observation, and that's only there at my request, because as I was looking and reflecting back previously on the conversations that we've had on sharing confidential data, wanted to ensure that there were consequences in place that if it's violated. I think your point is very well placed and very well taken, and it would not be offensive, it would be probably appropriate to remove that language out of Title IX in this part of the bill, and consider, as you suggested, in Title VI to address this. And if that's an amendment, I would second it.
So moved.
Second, I get discussion, Mr. Chairman, do we have a current crime in Title VI and the misdemeanors for, and if LSO could find that, just tell me what it is.
Yeah, and I would just add to that, the reason I put it is as I reflected in Title 14 and these other statutes referenced in material, there was that reference, and so I added it. So do you know, staff, is there something in Title VI? And if you don't know, could you determine that? Determine that. If there is, get it ready for the next meeting. If there's not, let's have an amendment in this bill to address that.
And Mr. Chairman, if I may, just
Please.
briefly, I think, yes, it is kind of an odd placement to put it in Title IX. Throughout Title 14, in a lot of these sections where it discusses, all records concerning reports and investigations, like this is 14.3.214, that very similar language is included on a lot of these, where there's the discussion of the confidentiality. It's not necessarily in Title VI. It's just where there is confidentiality, they just kind of tack on this. If you willfully disclose the information, it's a misdemeanor.
Yeah, but I think the point is taken, Senator Nethercott, not to add confusion in Title IX. And so let's clean that up. So the motion is to remove that and have something after research is done to address this concern, whether it be adding statutes in Title VI or to someplace else. So with that, that's the motion?
That's the motion. And so the motion would be essentially to strike the reference to it in this bill draft, create a new bill draft that addresses the intentional disclosure of confidential information as identified in federal or Wyoming law, and that to be in Title VI, some likely a misdemeanor, and the penalties associated with that misdemeanor should be consistent with all other misdemeanors.
So the motion for this bill is just to remove that section, and then the assignment is to create a new bill.
Correct.
Okay, so those in favor of the amendment, so say aye. Aye. Those opposed, if any. Thank you. Anything else on page 2? Page 3, anything pertaining to, that we want to act on in the staff comments? Do we want to, is there any appetite in looking at specifying who can receive the data requirements through written agreements? Does that perk the interest of anybody?
Mr. Chairman?
Please.
Mr. Chairman, I think DFS will probably go back and see if there's some guardrails that they might create if we're going to keep this bill draft open rather than vote on it, and if we get additional information, maybe.
Okay. Moving along, page 4, page 5, these are just, this starts to conform the language of, on page 2 into the various statutes. Page 5 and page 6. Please, Danielle.
Chairman Larson, it might be helpful at this juncture to ask LSO the reasons for adding the additional conforming amendments. In our review, we identified some of those referencing multidisciplinary team meetings data, and I don't think that that necessarily meets the intent of the statute. So if I could, Chairman Larson, perhaps ask LSO to.
So could you give us a reference of that in the bill?
So, Chairman Larson, one example would be 14-3-427 on page 4.
Okay. Staff?
Yes, Mr. Chairman, thank you. There were a few, I believe, 14.3.427, 14.3.437. There's just a couple that I included in there, just because I went throughout the entirety of Title 14. That's where all these additional provisions are added for things like this. It was more just since we were getting into there and it's discussing confidentiality. If there were any purpose, it was just trying to cover all of those, but those can easily be removed out of the bill if they don't meet the purposes of the bill draft.
So your thoughts, Ms. Marks?
Chairman Larson, at this point, in consultation with some of my team yesterday, we would recommend striking those that relate to MGT meetings unless we're missing something.
So can you give us in the,
Yeah. Do you want me to speak out the exact references?
yeah, where are they at on here in the bill so that we can make sure that we're all,
So Representative, or Chairman Larson, 14-3-427.
so
on
go to
page
the,
4.
go to the bill page number,
Page 4,
page 4.
line
what?
14,
Line 19,
line 14,
14, okay,
page 5, line 1,
okay,
page 5, line 20,
okay,
page 6, line 6. And these pertain to juvenile justice court records, which were not in our original recommendation list.
okay. So the motion,
And Chairman Larson, one more.
okay,
Page 7, line 1.
okay. So then the motion would be to delete these references from the bill. Is there a second?
Second.
Okay, discussion? Senator Barlow?
Thank you, Mr. Chairman. And I appreciate this. It was not a recommendation from the department. And I also understand our LSO is trying to be complete in their review. But if I understood correctly, these are all have to do with juvenile justice. So maybe if somebody from the courts or corrections would step in and ask or give us any thoughts they might have, or have it for the next meeting, just in case we need to revisit any of this, if we strike it, because we're talking about striking it now. It won't be available to the next meeting unless we have some follow-up. So any suggestions or thoughts from the folks that potentially are impacted by this? Thank you.
Mrs. Butler?
Mr. Chairman, Senator Barlow, I don't see any problem with removing the reference to multidisciplinary team records from data sharing, and that would be through DFS, right? So those are the DFS records that they have of those multidisciplinary teams that meet prior to a hearing to determine what they're going to recommend to the judge in a juvenile case. And so in my mind, those are really frank discussions amongst those team members. And so it would make sense to me that those would not be data that you would generally share out just because of the nature of those team meetings.
Okay, any other comment? Senator?
So, Mr. Chairman, just so we're clear, that the purpose of this, going back to page 2, line 14, individual case planning and et cetera. So I don't disagree with what's being said. I just want to understand if we're going to start adjusting some of this, does some of the purpose need to be actually accounted for in that as well? And what is a planning process? We're trying to understand what planning is. Is it that you had the meeting, or what the outcome and what the options of the meeting were, and what was ultimately selected? Because part of what we're trying to do here, Mr. Chairman, I believe, is track success or understand where the greatest successes are. So I'm clearly fine with eliminating it, but does that mean we actually need to rethink about our
Language on
the language of the purpose of the bill? So thank you,
Mrs.
Mr.
Marks.
Chairman.
Chairman Larson, Senator Barlow, it's a good question. I think that it goes above and beyond the types of data that we had in mind. I do believe that the MDTs currently have authority to share data for the purposes of making decisions on behalf of the child involved. And we do have AG representation here in the room. I don't know if.
No, I don't think the question so much is removal of that, but it's going back to the new language. Does that need to be refined to be more specific on the purpose of what you're trying to do there? So that might be something to consider. I think there's not an objection to removal of the MDT meetings, but if you look at that new language, it implies a pretty broad swath that arguably would have included this, and now you're saying, no, it doesn't. So maybe you might contemplate maybe a little more descriptive language on 2, and if not, fine, but I think is that a fair question that we're kind of asking?
Yeah. Chairman Larson, I think we'll take it back to discuss amongst the team and really and refine the purpose and ensure that we're not missing anything. But at this point, we all agree that the MDT data is not necessary in the conforming amendment.
So those in favor of the amendment to remove the references outlined on those pages, say aye. Aye. Oh, did we have a question, Senator?
Mr. Chairman, I just want to clarify, there was 5 sections I have crossed on my.
We
Is that
have.
accurate? I just want to verify with Luke and with everybody that we're all
Yep.
crossing the same thing. 5
So we're saying the reference on page 4, line 14, page 5, lines 1, and again referenced on line 20, and on page 6, line 6, page 7, line 1. Is that?
Thank you.
Is that it? Okay. Again, those in favor, say aye. Aye. Those opposed, if any. Okay. Anything else in the bill before any other amendments? Senator Chairman Zwanser?
I'm not sure it's an amendment, it's more of a question for the Department of Health. I just want to make sure our statutes are going to be congruent, and I don't know what in the Department of Health when it comes to, information sharing and longitudinal studies and privacy relations. I guess my question is, do these match up with there's some data sharing that these 2 agencies do between one another. It seems like we're going to make sure, to the fullest extent possible, we're going to try to get information, do some longitudinal studies, making sure the Department of Health can share some information in some of these cases, but B, it's similar to what is included in the Department of Health.
Mr. Chairman, Representative Zwanitzer, I'm not aware of any statute changes or conforming changes we would need for this. We're happy to do a review should this move forward to see if any of that would be necessary. I think we're okay. Again, most of these would be very specific to our interactions with, and you'll see it peppered through statute where, judicial information or data that Family Services has cannot be shared aside from Department of Education, Department of Health, because we're participating either as Medicaid coverage or what have you. But we'll do a review prior to the next meeting and make sure there's not something that we're missing.
Any other comments on this, Senator Bartle?
Thank you, Mr. Chairman. So I'll go back to one of my first comments. In Ms. Marks's overview, there was discussion about statutory limitations. So there are no repealers in this bill. There are no strikes or anything else. So I just want to make sure, and the notwithstanding language to the chairman or to the speaker's point, kind of blankets everything. So I just want to make sure that if there are statutory limitations elsewhere that they're addressed in this bill, if there are something there. Because anyway, the second thing is, and we don't have to deal with this meeting, I think we ought to have a realistic timeline of rulemaking and effective date. Because I think it's impractical to have an effective date the same date as the rulemaking begins. There has to be some kind of rollout. So, because otherwise there's an obligation to actually carry out this statute before rules are established. Thank you, Mr. Chairman. And we don't have to discuss that now or get a timeline, but I think that's for the agency to.
Well, and
Thank you.
I think it's kind of a fair question as we draft the bill, getting ready for the next time, but do you have some thoughts on that, Danielle, as if we made it effective where we traditionally did it in July 1, does that give you time to get rules made over that period of time, or do you want to make it effective in September?
Chairman Larson, on the fly, I think July 1 is soon. September would align with the planned launch for the new case management system for child welfare. You're talking about July 1 of 2025. I think that would be adequate. Thank you.
That would be adequate?
Yeah.
Okay.
Mr. Chairman.
Please, Representative Summers.
Planning.
Go ahead, Representative Summers.
Mr. Chairman, thank you. And I won't bring it this time because it'll fail, but eventually I'll bring it and it'll fail, would be another section that is a report to Labor Health from DFS on the types of data that has been shared and the safeguards that are in place to protect that data. Judiciary, whatever, it doesn't matter.
Okay,
I like Labor Health because the Labor Health guys are here.
there you go. Is there a comment over here?
Mr. Chairman, just a suggestion on the rulemaking and the timeline. So several years ago, you all passed the comprehensive behavioral health redesign that we're implementing this July. This past session, you passed two bills that changed some of those statutes. So now we did not kick out that timeline, but just for rulemaking provisions, there is a way to promulgate emergency rules immediately concurrently with standard rules, which have the LSO review, public comment, governor's review, et cetera. And I think that since this would presumably be worked through the session and could be changes, would just suggest that DFS could go down that same kind of path where July 1st or even immediately, you're executing all the acts that are necessary to become law. You can do that through rulemaking provisions more quickly than the 120 to 180 day timeline of standard rules while doing the standard rule promulgation with the public comment.
Well, and I think that the question to that is we generally try not to circumvent the standard process to just allow public appropriate time to respond and to digest that. And so unless there's an urgency in getting this done, I would assume that we would follow traditional rulemaking procedure. If you feel that there is an urgency to it, then you can make that recommendation to us. Okay. All right. Anything else on this conversation?
Just, Mr. Chairman.
Please.
Mr. Chairman, sorry. I went through all of the debate on SLEDs in committee when it happened in education and all the concerns there were about releasing individual data, whether it was right or wrong, the concerns that existed. I think there'll be even more concerns about this bill. And I'm hoping we can corral this bill more than it is now, because I think it would stand a fairly poor chance in the legislature if we can't at least articulate the, better in the bill, the safeguards that are in place. Thank you.
I agree with that thought. I remember those conversations too, and, you know, there was a lot of emotion on that conversation, and I don't know that the structure of the bill is wrong, but we've got to be educated and be able to provide enough information on specifics when we talk to our colleagues to give them confidence that we're not selling our children into slavery in a third world country for mine geodes, right? Rare earth minerals, there you go. Please, Senator Barlow.
Thank you, Mr. Chairman. So on that note, and so something must have been accomplished in making at least enough people comfortable to accomplish the SLED's discussion. That was either done through statute or was done subsequently through rules, through WDE or whoever. So is there something we can actually pull out of that process and bring to this that codifies or coordinates that same level of understanding? Saying, look, we're doing this. This is not a departure. This is something we have in place instead of whole new cloth, potentially, just as a reference point. Because I would agree, Mr. Chairman, if I could, to the speaker, notwithstanding means notwithstanding. How about, how about we say something consistent with this instead of the other? So maybe there's something that we can say consistent with these other standards that we've already adopted. So anyway, I just throw that, I don't know what it is. I've not been in those conversations. So thank you.
Okay. All right. With that in mind, staff, I think you're comfortable with the request we've made. And then I would just welcome task force members as they contemplate if there's something that comes to mind at 2 in the morning to share that with staff between now and our next meeting on this bill, if there's something that we've missed or something that you'd like to see in addition for that comment. Okay, moving on, we're going to move away from the confidentiality statutes, and we're going to go into the conversation on vulnerable adults. As we got ready for these interim meetings, we spent a lot of time with Department of Family Services, Department of Health, and
Mr. Chairman,
yes,
can I throw out another concept here as we work this draft?
please.
So as you can see in these, like on page 7 and on page 6, so on page 6, lines 1 through 4, and page 7, lines 6 through 9, you can see in Title 14, what Lucas was mentioning about these misdemeanor prohibitions sprinkled in throughout Title 14. So a suggestion for this committee is to find all of those references in Title 14. Instead of putting the penalty and the citation right there, instead to create another section in Title 14 that just says a violation of this act may be subject to criminal penalties as found in 6, whatever, in Title 6. And then we make that same reference in Title 9, so the person who's reading that confidentiality statute
Agreed.
knows that there could be a criminal penalty. And then the core of those criminal penalties are found in crimes and offenses of our statutes. And so we kind of clean up Title 14, which would shorten the green books, and consolidate crimes and offenses associated with this type of
So in
violation.
14, on those notes, you'd say as penalties are as outlined in Title 6, just make that reference.
Yeah, and this is a drafting
Yeah.
preference, and I'll leave it to the discretion of LSO, but what I'm thinking is we just strike it throughout Title 14, add a special just section in Title 14 that says a violation of this act concerning confidentiality or whatever could be subject to criminal penalties in Title 6. And therefore, it's not continued to be referenced.
So would it be appropriate then to just make that part of the bill draft on the Title 6 piece?
Yes,
Okay.
in the Title 6 piece.
Yeah.
Yeah.
And as we do that, then we'll just remove them. It would be reflected in the Title 14, and then probably shorten this bill up. But I think it would impact this bill if the other bill passes. If the other bill doesn't passes, then this language would need to stay. Right?
Maybe.
I mean, that's kind of what we've had to do on some of those other bills there where, and we can just put in there that if the other bill passes, this goes away and shorten it up.
I don't know that one is contingent on each other, Mr. Chairman. I think what we're talking about is providing a clarifying criminal statute associated with the intentional disclosure of confidential information. And so that could stand on its own. It may need some amendments associated with how LSO weaves it into this bill, and references to Title 14 and Title 9, but I think it could stand alone.
Okay, very good. We have a plan. Okay, now, Danielle, as I was stating, we're getting into having an additional conversation on vulnerable adults, looking at those services that we have around the state. In committee, really what we're trying to get resolved is, at the end of the day, what should we be able to expect as policy that people who are identified, who qualify or are identified as a vulnerable adult, the services that they should be available to protect them to whatever degree throughout the state. And we'll get into further conversation on this as Mrs. Marks talks about all of the information she put together. But I think that this has gone a long way to help us see what is available and then maybe where some gaps are around the various counties. Danielle. Spit on it. There you go. See?
I was warned it's hard. Again, Danielle Marks, Senior Policy Advisor, Department of Family Services. And thank you for allowing me to stay here, but I am joined by my colleagues at the Department of Health, Elizabeth Forslin and Jeff Clark, who will be sprinkling in information as we move forward to talk about services that are state funded or provided for vulnerable adults and individuals at risk of becoming vulnerable.
So Danielle, in committee, as we go through these documents, I think we're just going to open that up for conversations because we cover a lot of different programs rather than going back and try to rehash them. As you have something as we go along through this, that's just open up for conversation, please. Okay, Danielle.
Chairman Larson, as you said, there are two documents. One is available publicly, which is the summary of state programs and services for vulnerable adults. And we're going to go through a couple introductory slides, and then I will share screen with a more comprehensive look that looks at a services spreadsheet. But I just want you all to be aware that those two documents, the state summary and the spreadsheet that I'll walk through, are complementary, so you can reference the same information back and forth. So to kick us off, in the last year's task force meetings, I know you had a lot of discussion around who is a vulnerable adult. And we've framed our brainstorming about this presentation in three ways. So one, there's a legal adult protective services definition for vulnerable adults. You can see that on the slide. And I know this task force has communicated about that in the past. But we also think about vulnerable adults in terms of their eligibility for programs. They might not meet the definition for a vulnerable adult according to APS legal definition, but they might have needs and/or situations that make them eligible for programs that the state funds or provides, such as Medicaid waivers, senior center services, et cetera. And that these eligibility categories differ based on state and federal regulations regarding funding sources. And then lastly, there is this group that's a bit more nebulous, which is individuals with risk factors that might be referred to state-funded programs, up to and including APS if there's an allegation of abuse or neglect, but who do not now and may never meet the legal or program definitions for either APS or a number of the other programs that the state funds or provides, such as waiver, senior center services. Often these individuals in communities might hit that wall where there's really nothing there for them, but they still exhibit risk factors, could be loneliness, isolation, or a diagnosis that might not meet the program definition to receive services. And this task force is no stranger to this fact, but when we talk about vulnerable adults, we're not just talking about older adults. High needs youth, which is a topic that we'll cover later this afternoon, can be vulnerable adults too, and we do see that cross population in DFS data. So less than 5% of APS clients were adults of that younger age group in SFY 23. And then when we talk about the high needs youth and the Interagency Children's Collaborative that co-case manages those youth's care, 5 of those served through the ICC in calendar year 2023 met the legal definition of vulnerable adult, and some had formal APS involvement. So there is an overlap of that younger adult population who meets the definition of vulnerable adults.
So Danielle, question that I have, but would we agree that the path for these vulnerable adults coming out of the adolescent cohort going into the vulnerable adult definition, it seems to me that the path is more defined for them to receive ongoing services with the support, comprehensive waivers, and things of that nature, rather than this population that comes into the vulnerable adult definition as they get older. Is that a reasonable observation, or have I missed the boat again? Elizabeth, please.
Elizabeth Forslund, Department of Health. Mr. Chairman, I think that that is a reasonable assumption. I don't think that those are two discrete categories. I think, as you and others know, we had a waiver redesign back in 2014, where for the comprehensive and the supports waivers, those serve individuals who are throughout the lifespan. And so individuals who are younger can be receiving those services and supports while they are also youth potentially involved with DFS and are on that track to still receive those services because of their continued eligibility.
Individuals identified because they've gone through the K-12 system. And so whether that handoff comes really well, I think they're identified in probably the large majority of those cases, either are on a comprehensive or supports, or at least on the waiting list, because they would anticipate them aging out of the K-12 system. Is that fair?
Mr. Chairman, I believe that would be fair to say in the majority of cases. There are handfuls of cases every year where parents, family members have depended on that K-12 support system and have delayed in applying for the comprehensive or supports waiver until an individual is 16, 17 years old, and that graduation point is in sight. And that causes a bit of a panic in what happens next when we don't have those educational supports and that DFS support. So yes, the majority of cases, I agree with you, but I think that we still see a not insignificant number of folks who have delayed that application until they're close to that graduation point.
Thank you. Please continue.
Mr. Chairman, so the landscape nationally, federally for vulnerable adults is fragmented. So historically, there's been no federal home and limited federal funding for adult protective services and then vulnerable adults generally. But the materials deadline for this task force was May 8th, and on May 7th, there was notification, 30-day notice that as of June 4th, the federal government has established rules guiding national standards for adult protective services. So while we don't have a brief prepared for you all to understand what those federal rules and standards look like, we are happy to provide that ahead of the next meeting.
Please.
But I think that's potentially exciting, and it might be good timing for this task force to know that there's more support and more guidance than has been regarding APS generally.
So if we may, if you could put that together and get that out ahead of time so that
Absolutely.
LSO can then get it to us and we could have digested it before the next meeting. Representative Summers?
Mr. Chairman, thank you. And particularly, what funding may they be providing for what parts? That would be one of the most important things, so we can understand that.
Chairman Larson, Representative Summers, we already have some material prepared. We did receive a small grant of $106,000 this spring, and the future funding amounts are currently unknown, but we do expect some funding, and we can provide that information as much as we have available to us at our next meeting.
Thank you. Continue.
So that's just an exciting kind of late-breaking update. But outside of that, there is and has been federal legislation, the Older Americans Act and the Elder Justice Act, that kind of governs the senior center funding that comes out of the Department of Health for aging adults. And those are, managed by the Department of Health. So this is a summary of what you heard last task force session, in that the system for vulnerable adults is not well defined federally, especially when you think about vulnerability across the continuum, so including those that have those minor risk factors all the way up to those that meet definitions for vulnerable adults and are alleged to be victims of abuse and neglect. So this sort of kind of sets the stage for a review of the services that are available, and I add this just to punctuate this storyline that often APS is viewed as the default system for vulnerable adults, and quite appropriately in those cases where the individuals meet the definition and there's alleged abuse and neglect. But as you've heard, APS has $80,000 a biennium in a budget, and we staff 6 caseworkers that fully dedicate their work to APS. And the rest of the field offices are supporting that work with combined caseloads with CPS and juvenile justice. We are grateful for the approved exception request this past session that increases our number of APS dedicated caseworkers from 6 to 8 effective July 1st of this year.
Is that using ARPA dollars?
Chairman Larson, no. It's part of our standard budget.
Thank you.
The point being, though, is APS is part of a larger system of services that I think we all agree. And all individuals that are served through APS are referred to community-based services, many of which are funded through other agencies, which the resources that you have in your hand kind of describe. So I believe this visual was shared last year, but we just wanted to use this again to establish a framework for the services that we're about to go through. And this kind of aligns with what we talked about on slide 1, which were the definitions of vulnerability. So at the far right would be vulnerable adults that are meeting that legal definition and being served by APS. And in those more emergency cases, receiving emergency services. And then as you back out into the left side of the continuum, we're seeing vulnerability, but at less severity. And the services that are available to those individuals might look different. They might look like basic needs, like food assistance or resource and referral, versus more intensive services like residential and more state involvement, essentially. And I think it's important too to reiterate on this slide that the majority of cases that are accepted by the Department of Family Services are prevention or assessment cases. So about 90% of our accepted intakes are, adults that just need a little bit more case management, supportive resources to be able to stay safe at home. And less than 10% are investigation cases.
Mr. Chairman?
Please, Representative Summers.
Mr. Chairman, so just, I would like to understand that number. So if you got 1, 2, 3, 4, 5, so 90% occurs in which categories and 10% occurs in which categories? Thank you.
So Chairman Larson, Representative Summers, for the 90%, and let me pull up my data on accepted intakes. So in state fiscal year 2023, the department received 2,372 intakes. And of those, and this is another data point that's probably of interest and has been shared before, of those 50% are screened in. And last time we talked about what does it mean to be screened in or screened out. And of those, 90% are assigned to an assessment or prevention case where there needs to be case management and support, but there is not an allegation that needs investigated for abuse or neglect.
Please.
Mr. Chairman, so just so I can be clear, if I can do the math in my head, we're at 1,000 cases then? Is that accurate for whatever?
Chairman Larson, Senator Barlow, it was dancing around my page, but in state fiscal year 2023, 1,144 intakes were screened in. Of those, 92% approximately meet the definition of a prevention or assessment case.
So, Mr. Chairman.
Please, Representative Summers.
So, Mr. Chairman, just to be clear, so those individuals would meet, that are screened in, would meet the definition, the legal definition of APS. Is that right?
Chairman
That's
Larson.
what I'm trying to figure out.
Representative Summers, that's correct.
Okay.
Thank you. Continue.
All right, so we are going to give you an orientation to the services spreadsheet with some upfront cautions and interpretation advice. So the first being that eligibility for a number of programs represented on the services documents that we provided varies by a number of individual characteristics. That's sort of an obvious, but it could depend on age, disability status, income, capacity to make decisions. And then also service availability may vary based on funding, provider availability in communities, especially those more rural and frontier communities, and the ability of the provider service line to meet the individual's needs. And it's important to note that providers are not required to deliver services or serve specific areas, and that's where you'll see some variation across the state. It also is important to note that awareness of service availability across the state might vary. I do think we're making some strides with some investments in resource and referral to, go ahead, Chairman Larson.
Finish that comment, then I'll ask your question.
Sure. The kind of early part of the spreadsheet discusses resource and referral options such as Wyoming 2-in-1, the Aging Disability Resource Center, or ADRC funding, as well as family resource centers. So I do think that while awareness of service availability may vary, there are state investments that are trying to make those services better known to those that might benefit from it and coordinate better.
So I'd like to tease a little bit that comment that you say that the providers are not required to deliver services or specific areas, to deliver services or serve specific areas in the state. That's accurate, but we do require them to serve specific populations. And those populations then live in various parts of the state. Is there then any requirement that says if you're serving this population, you have to do it in their community? Or do we say they're eligible for these services, but they have to come get it if they live outside the community where the provider provides it?
Chairman Larson, I'm going to punt that to Ms. Forsland.
Elizabeth?
Chairman Larson, that's a great question. I think just like with a medical provider, The provider is an independent business as far as the waivers are concerned, and so they, hang their shingle out once they are certified by our program within Department of Health, and they define the service area that they are able to serve. And so someone might be able to serve Laramie County, wouldn't be able to serve Albany County if they lack the ability or willingness to travel to that county in order to provide those services. Similarly, we wouldn't expect a provider to commit to serving Laramie County and also Teton County to be able to travel all the way up to that area of the state. I think that the secondary piece to your question is that, yes, providers are certified to serve the population that it is on the waiver, but they also are able to pick and choose what services they provide. Just like a medical specialist is certified or chooses to deliver services, maybe an endodontist rather than general dentistry services, a waiver provider can select what services they are able and willing to provide. For example, somebody might not be able to provide residential services, but would be willing to provide adult day services within Laramie County. And so they have the ability to define what their specialty is, what they're willing to deliver. But we do also ask them to define the service area that they're willing to serve.
So just follow up that you could maybe fill in on, but that's really in the contract component of that. So as they come to you qualified to be a provider, they don't just come to you and say, this is what we'll do. They come and they qualify per the requirements that the Department of Health or whomever may have, and then they would be expected to meet the conditions, or those expectations would be part of their contractual agreement, and if they're not able to do so, then that may be a waiver of that. So Director Johansson, please.
Yeah, Mr. Chairman, Elizabeth did a good job explaining kind of on the Medicaid and a Medicaid waiver side what the expectations are, what that back and forth is with providers, which is variable. We have waiver providers that are serving a specific population, are subject through provider enrollment or waiver agreements to provide certain services, et cetera. Medicaid providers in general services can really vary. As Elizabeth mentioned, you enroll as a provider in Wyoming Medicaid. Now you can choose to receive and treat Medicaid clients, and there's certain provisions you have to follow, rates that you're reimbursed at. To your earlier question, because I heard this in what you were asking, in terms of Department of Health Services in general, the simple and frustrating answer is that it really is a mixed bag. For example, with senior centers through our Older Americans Act and General Fund, that is somewhat more prescriptive in that you're selected as providing these services in a certain area, and here's what all of the senior center clients, so to speak, will be able to receive there. And even that can be variable. We have some senior centers that participate in home services, some that don't, and it really is quite variable. So all of these services and service arrays that you'll see in this spreadsheet, I want to be clear with the task force because it's really easy to go down into the weeds and find your particular county or area and see what is there and what isn't. But I think we all know across Wyoming, it's just not standardized across the state. That can be a population base, that can be a problem of scale, that can be you just don't have this type of provider or service within 100 miles. So it's really, I hate to frustrate you in the task force, but it's really a mixed bag on what the provider requirements are, what the service availability is in certain areas. And it depends on if it's Medicaid, general fund, federal grants through the Older Americans Act, et cetera.
So thank you, Director Johansson, Elizabeth, both in committee. I'd just like you to consider as we have this conversation, as we have a variety of services available that are out there, and they do vary significantly. And although we appreciate flexibility in allowing them to develop programs, we often find that then the types of services vary greatly. And that's what we've seen when we started down the road on the behavioral health redesign was try to get some conformity to say, for these state dollars, these are the services that we expect to go out to a population that's being served with these dollars. And so I think that it might be worthy as we have this conversation to then be thinking about, for example, on senior centers, of these state general funds that you receive, which is not in total all your income, but of the state general funds, what is it that we would expect you to do and have that be somewhat consistent around the state with some flexibility? I just think we need to be looking to see how we get more of these services that we fund in state general dollars out to the populations that we're talking about here. Did you have a comment?
Thank you, Mr. Chairman. So I think that to the point that I think Director Johansson talked about, when we adjusted with House Bill, whatever, the number 7, I can't remember, it was a Senate file or House bill, added vulnerable adults to the behavioral redesign, we may have created the potential for consistency for one component of the services that are of interest. We have not dealt with the other array of services that a vulnerable adult may need across a broader spectrum.
Bingo.
To your point about the senior centers, I have discussion in my own community, because if you're below a certain age and you have early onset dementia, you're not eligible for services of that because of the federal act. And my case has been somewhat to the department, but certainly to the Senior Services Board, has been, well, then we need to adjust it. So folks that have a need for these services don't meet some definitional criteria, but still should have access to these services, at least through state dollars. So I think there's more to ferret out here. We may have covered a little bit, part of it, with what we did with this past bill, but where are the other places we can actually fit in with state-funded services if there is a federal prohibition, notwithstanding the fact that maybe the feds have opened up some of their opportunities with this new, with the new things they're putting out. So anyway, I think it's a fair discussion. And then I'll bring up at some point, guardianships are becoming a challenge for these vulnerable adults in some communities. It's not just the services, it's just the fact to get them representation so they can get to some level. So anyway, thank you, Mr. Chairman.
And I may, just so we don't let that ship sink completely, that, this year we've got funding for Adult Protective Service guardianships contract with Wyoming Guardians because of that shortfall, but we've done it with ARPA dollars. And we identified the need for that, and I think that again is some of the low-hanging fruit that we maybe need to adjust, because the contract with Wyoming Home Services we heard last year is really between the guardian ad litems and Wyoming Home Services, but we find in this case that they don't always have a guardian ad litem appointed, but we could making those guardianships available, and I think that's a piece of this conversation that's really kind of we can address early on, so just bear that in mind. Sorry, but just those are the things we need to be stirring around. Representative Summers.
Mr. Chairman, thank you. And when I read the big chart with all the stuff, the different funding sources, I understood even more the reason that was requested for a task force to kind of look at how you coordinated that. So my question, obviously we didn't go down that path, but I think we did go down the path of recommending that we do coordinate better, and I assume that's going on. But to this specific piece about service availability, and I don't know where else to ask it. I think we'll go through the main chart likely as well, maybe not. But there's some ARPA dollars that are being used for, it's called aging, and it's like on page, I don't know what page number, but page 2. Aging and Disability Resource Centers, and then it's plugged into 211. And so that seems like, particularly in areas like I represent that are very rural areas, the one opportunity to make sure that there's access to what is out there. And so can you talk about this? Was there success with this, with the ARPA dollars being used? Do you have any idea? Do you have any feedback from that system that was put in place, and whether it was successful in getting a broader reach into service availability?
So before we answer that, I assume that you were going to go through that handout and talk about those respectives. And if that's the case, maybe we'll hold this question until we get there. If we have, let you finish if that's all right with you, Representative. And then, so let's just continue on and then we'll cover that one when we get there.
Sure. Chairman Larson, I think the last two final points to make before we dive into the spreadsheet is that service availability does not equal directly quality or the availability of choice. We do believe that adults, well, not believe, that adults do have the choice to accept services and a choice in the services that they accept. So it's just an important caution here. And I didn't, lead with this, but I think it's been shared with the task force a ton last year. But that adults do have the capacity to make their own decisions, and we are not in any way requiring adults to accept what's available to them.
If I could chime in there as well,
Elizabeth, please.
Mr. Chairman. Also, with service availability not equaling quality or sufficient choice, I would like to just underscore sufficient on that slide. I know that in some rural areas, there are very limited choices, and forgive me, I should have said that I speak from the waivers perspective solely in my comments, but I know that in some rural areas of the state in particular, there is very limited choice for service availability. Just because one service provider might be available in that area doesn't mean that that might be sufficient choice for an individual. So just wanted to highlight that piece and throw that out there as well.
Okay.
Mr. Chairman, bear with me, I'm switching screens.
So I'd like you to just touch on slide 13 a little bit on that same document, if you would, on the senior center and older adults persistent perspective. That very last page before you get to one that says questions.
Mr. Chairman, happy to.
I assumed they was going to go through all the pages.
Well, and so,
The next one is.
oh, okay, I'm sorry. I'm jumping ahead now, so let's just go through the work.
Chairman Larson, if it provides important perspective, I'm happy to just share these two slides for the public and for the task force members.
Okay, and then we'll go to the,
Yeah.
okay,
That
let's do
works
that.
okay? Yeah. So a couple years ago, we surveyed adult protective services caseworkers as well as stakeholders on the top needs for vulnerable adults. And I think this is just important to set the stage for what folks on the ground are seeing in terms of top needs. Guardianship, top of the list, no surprise. Transportation, access to grocery and meal delivery, housing, home health, and you can read the rest. And then lastly, like access to services for individuals who do not meet program eligibility. That kind of goes back to that first slide when we're thinking conceptually around those three levels of what we consider vulnerable adults. And there is a subset of vulnerable adults or those that are at risk that just don't meet many program eligibility requirements. And then from the Chairman Larson.
So on the transportation point, AARP has put together document that we're going to hear from them on, I think, in June. And, but that seems to be a consistent issue on this vulnerable adult thing for those living in frontier areas, trying to get to a population where they can get services, or just within towns. And we've made a number of attempts to various programs to help with this transportation component, but I think that this is going to be a critical thing that we address or try to consider on how to address it moving forward, but just bring that to your attention, please.
And then from the senior center's perspective, again, this is from the Wyoming State Plan on Aging, which included a needs assessment component. So these were just some themes that were pulled from that report, including rising cost of long-term support services, availability of healthcare, loneliness and isolation, and then barriers, again, some themes that are repeated across APS and senior centers regarding transportation, housing. And lastly, I think to Mr. Speaker, your point around ADRCs, that point person for support. So the services might be available, but especially in our more frontier communities, they might not have a hand to hold to guide them to the services that are available.
So to the point of long-term care in long-term support services, I think what we historically see is that those who are self-paying or had some sort of insurance are having to make up some of the shortfall that those entities receive through Medicaid reimbursement. So then my question, Director Johansson, with our rebasing and in allowing 100% of Medicaid cost being implemented for those long-term care providers, that should have softened the need to increase the cost on the self-pays. Would that be accurate or not?
Mr. Chairman, I think there's an element of that, and to be clear, that action was for nursing home reimbursement rates. That, yes, I think was significant investment there, and essentially, I think you're right. It closes a gap between what the costs are to provide services to a Medicaid client and what the Medicaid program was reimbursing. That's probably a deeper discussion about a nursing home's business model, whether they focus on Medicare rehab, custodial Medicaid coverage, private pay. Usually it's a mix, but it really is dependent on how the nursing home structures their business and therefore what they have to staff to that kind of determines their cost. In addition, long-term care rate rebasings on the home and community-based side has also been a topic of discussion the past several years, and an increase was put in place. I think you'll likely hear further discussion from the Department of Health this year and going into next year on rates for home health. We're certainly seeing that area of service demand grow. It's always like I said, a balancing act between what's sustainable for providers throughout Wyoming, especially in rural communities, to be able to provide that service. But I will scream from the rooftops that the long-term care rate investment the state made has been very significant and important for that industry over the past year and a half.
Thank you. Please, Albert.
Mr. Chairman, thank you. When I served on appropriations many years ago, I remember a presentation by Department of Health on our aging population in Wyoming, and it was a kind of a scared straight presentation. And then Mr. Laycock kind of brought that back to my attention in a recent conversation we had. I think it would be, from my perspective, you probably got updated numbers on what your projection is of this population. And obviously, vulnerable adults are a segment of this population. So what are we looking at? Could you get us maybe a little data on what are we looking at going forward with this aging population and what we may have to address in the new? I think it's important to keep that in front of the legislature at all times. The amount of the significance of the aging population in Wyoming.
Mr. Chairman, Speaker Summers, I'm happy to provide that, and you're right, the demographics in Wyoming are changing, and this is one time that I'll say, unfortunately, we're on track with those demographic changes that have not really diverted much from what our projections were several years ago when we released that report. Population's aging, and so all of the subsegments, as you mentioned, of that aging population, like adult protective services, the increase that we're seeing in dementia and memory care needs, those continue to be exacerbated simply by Wyoming's demographics. On the cost side, because the Department of Health, mainly through Wyoming Medicaid, is the largest payer of long-term care services, is where it becomes policy decisions for how we sustain the nursing home industry, the assisted living facility industry, and the home and community-based service industry, which is a big priority for the department since most folks want to stay in their homes and communities. So I believe we updated that aging report last year. It might have been slightly before that, but we'll get it in front of this committee. And like I said, it's the numbers are scary, but I think the legislature should be proud. There's several investments that have been made, especially to be able to cover more costs, sustain providers. It seems like it's always ongoing, but there's been efforts that have been made to at least help Wyoming weather the silver tsunami, as it were. Thank you.
Okay. So are we ready for the spreadsheet? Yes, please. Yes, please, Heather.
Thank you, Mr. Chairman. I just wanted to, I think this is a good opportunity, a good segue based on Representative Summers' comments. after the Department of Health presentation on aging in Wyoming, I started to really look at the criminal justice population and what slice of that is coming out of our prisons that would be impacting communities and ultimately impacting state resources. And so I agree with Senator Barlow. I think through the behavioral health redesign, which we are really working well with the Department of Health to implement that July 1, I think for our group of people exiting our facilities, we will have a good picture of their vulnerability through the behavioral health redesign. We're identifying a lot of individuals who meet that vulnerable criteria one way or the other. But I also looked at our aging parolees as a result of Director Johansson's presentation, looking at those individuals who exit our facilities age 65 and older and what their impacts to the community were. And my hypothesis in this was that they were going to have high needs and they were going to maybe fall through the cracks, and what did that look like? And so for this time period that we're in, we have 22 individuals who are in our communities on supervised parole who are age 65 and older, and the oldest person is 82. And I was really surprised to find that the vast majority, all but 2, are actually doing well. And they have housing, they have income supports, some of them are working with the VA, they work with their community agencies on food assistance, they are getting services from their senior centers, and they are faring much better than I thought they might be, just based on coming out of the criminal justice system and some of the issues that go with that. But the key to that, to those findings, was the case management and the work of our case managers and our probation agents and the other case managers in the community. And I bring that up because I see on the slide from the senior centers that point of contact is so important. And I think that is case management. And so as we talk about what is the role of the state and what can the state do to support individuals in our state, I think we can't underestimate the power of good case management. And it's part of this discussion, it's part of behavioral health redesign, it's part of treatment courts, it's part of diversion courts. It's just really key. And so I just share that because I think that presentation that the Department of Health did should raise a lot of questions for us personally in our own families, as well as at a state level. And so we're really looking internally at what are the needs of our folks as they leave our facilities. So thank you for letting me share that.
Thank you. We're ready to go into the spreadsheet. Before we do, I think we're going to take a break. And we're running a little behind, so we're going to have you shift gears when we come back. And but good conversation, and we're kind of impeding on your time a little bit, Alyssa, but we'll get there. So that's come back in about 15 minutes. 10:30. We're going to start back in. That's not 15 minutes. It's 2 minutes. That's 30 seconds. Thanks for the timeout. And so we'll be going through the spreadsheet that kind of was a handout that just kind of lists the services, Danielle, and we'll just turn that over to you to kind of walk us through as we discussed. Thanks.
Chairman Larson, I am attempting to make this a little bit bigger.
Look at you.
Wow.
That's why we've got her hired, Danielle. She's. Way to go, Clarissa.
Okay, so just to continue framing this conversation, this has a complementary spreadsheet that you all have access to that kind of shows these categories of services across the continuum of vulnerability. And these are in order, beginning with resource and referral, with the less high need, less vulnerable, all the way up to higher need. And as we walk through this, we just really want to understand and question the state's role in providing these services in every county, and whether the state's role is any less for those in rural counties. So comparing like the town center versus the rural and more frontier parts of a county. So resource and referral. So as we kind of alluded to, the state does invest through the Department of Health and Department of Family Services in aging and disability resource centers. That's one-time funds, ARPA funds, and that contract expires September of 2025.
So Danielle, on the ADRCs and the Family Resource Centers, those have been requests over the past couple of years for funding in the budget process. The legislature's turned down. We did fund them, and they're currently funded through ARPA dollars. I think for this committee, as we get going through there, are these worthy of ongoing funding? What are the benefits that have come through the Family Resource Centers that I don't think are in every community? But, to help us understand that better, because with limited budgets, I think we need to get the best bang for our buck. And when these funds run out in '26, is that something that we need to consider moving forward with? And so if we can, as we move forward, if you can just help us understand the value of those that are one-time funded, that'd be helpful.
Sure. So regarding ADRCs, this is a partnership with Wyoming 211, and it essentially gives a pathway for services that are already provided by Wyoming 211, resource and referral. And in the first 8 months of the ADRC contract, ADRCs served 265 clients on services related to case management, transportation, housing, to name a few. And
265?
265 clients.
Clients in what length of time?
Between April 2023 and December 2023.
Thank you.
Mr. Chairman.
Please, Albert.
Mr. Chairman, this one intrigued me. So, you mentioned the numbers, but do you feel like it had a real added value to the? I would think it would, because it seems like there needs to be some resource out there for people to easily get a hold of to be able to. Would all of those people been reached anyway? And through some other means, or was this kind of unique, and did you see a real value in it?
Mr. Chairman, Mr. Speaker, I do think anecdotally we're seeing a lot of success in quicker access to services, and Jeff Clark can speak a little bit more as he's a co-funder of the project. Jeff, if you have anything to add.
So as you do that, 265 clients, but do we know where they're from? Again, going to this bigger spreadsheet, identifying if they're in a populated town or if they're in remote Sublette County would be helpful to kind of understand.
Okay. Good morning. Jeff Clark from the Department of Health Aging Division.
I think this is our first time with you, isn't it?
It could be, yes.
Oh, hang on.
Thank you. Here we go.
Fresh meat, here we
Yeah.
go.
Chairman Larson and Representative Summers, I would echo what Danielle has said as far as Wyoming 211 being a great partner in this effort to stand up this ADRC. So that was the whole plan when we received funds from the Administration on Community Living to expand the.
Can you get a little closer to
Yeah,
your mic?
absolutely. When we received funds from the Administration for Community Living to expand the public health workforce, again, this was under the ARPA legislation that they had. We partnered with APS under Department of Family Services to pool our funding and support 211's efforts in bringing up or standing up this ADRC system, knowing that they had the infrastructure at least to make these types of referrals within
So
their network.
can I pause you there? So is 211 in DFS budget? Or is it in?
Yeah,
Director Johansson said that they're their own thing. Yeah.
They're their own thing?
yeah, absolutely. So
They're their own thing through who? We don't have a Department of 211, so who's partnering with that?
Mr. Chairman, I'm now completely embarrassed that I don't know the answer to that question, but I'll find out in the next few minutes.
This is a victory for Lloyd. Embarrasses Stefan. Good. Okay, thank you.
Excellent. So again, knowing that they had the infrastructure available to address these unique needs of individuals reaching out for resource support, we decided to fund them with these dollars that we had pooled with Department of Family Services dollars. Ultimately, what we were hoping to gain and what we anticipated that contract would look like is a local resource here in Laramie County to start with. It was more or less of a pilot service or a pilot project that we were trying to get off the ground. But 211 has actually taken the funding that we had and really taken this project under their wing and wanting to expand what is available. So what we're actually seeing, those 265 folks, and I don't have the specifics on counties, but they are attempting to reach a statewide basis with those individuals. So when individuals call, they're providing the resources over the phone that they can. In some circumstances, they are going out in person to meet with these individuals to help provide the supports that they need to reach additional resources. Options counseling is one of the main components under an ADRC type system, and I think that's a very valuable resource for these individuals that try to meet the state systems and services available and don't know which way to point, whether they would be eligible for Medicaid type services or whether they should be looking at senior service type resources. So 211, their staff is currently providing those options to those individuals and allowing them to help guide through the complicated state systems and find the most appropriate resources for those individuals. Again, speaking directly to the where those individuals are, I would have to get with 211 to learn a little bit more.
So when you do that, could we just request that we don't need to know the name, this is getting into this confidential information, you know, but if we could just find out the town they're in, because we need it more than just county. Okay. We need to know because the disconnect we're seeing in these services is a lot of these services and the service providers are in a more populated area, and it's these rural outlying communities, Burns and, you know, around here, that how do those people get these services? So is this a good resource for them to find out where it's available, and are they taking advantage of it, or the calls coming from within our populated area? So if we could find that out, that would be helpful for us.
Certainly.
Mr. Chairman.
Please, Albert.
Mr. Chairman, thank you. As I'm thinking of this, what does exist in most of these little towns, at least in the western side of the state, is a senior center, right? And I would bet that most, if they can, a vulnerable adult or a caretaker or something would go there first, right? So do they connect with 211, or do they have direct connection with Department of DFS or Department of Health? And how do we ensure that those folks are adequately trained to do some of this work as well, or do we do that?
Please.
Chairman, Representative Summers. You're correct. Senior centers, we rely on heavily to be a local resource for individuals seeking the supports that they need. I would say to your point about their connection with 211, 211, to my understanding, works with all of these individual community resources. So they have a database of all the local resources and the services that each of those resources provides within their system. So whether the individual, whether an older adult is calling 211 to find a resource, or whether they've popped into a senior center to find those resources, we try to bridge that gap and say, if the senior center doesn't know where to point this individual, if they can't provide the service locally, to connect with 211, to look at that kind of clearinghouse of all services that might be available in that community. Does that answer your question?
Yeah, just a quick follow-up.
Please.
Mr. Chairman, thank you. Do you have a concerted effort to train some staff in those senior centers? I assume they probably seek that out, but do you have a concerted effort to make sure those staff people have the wherewithal to provide this?
Please, Chairman, Representative Summers. I would say we do provide that information to our senior centers. A good example of this is just actually last week, we had a director training for all the senior centers that we partner with. And we use that opportunity to try to provide all the different resources that are available to these directors of senior centers, giving them a broader scope of what could be available to older adults, whether it's in their communities or available statewide. Specifically, we provide resources like 211 in those instances. So outside of just letting them know that those resources are available, I would say we don't have anything that, would be a structured curriculum for those centers, but we certainly try to inform them as widely as possible.
Thank you. Okay.
Chairman Larson, so to follow, Family Resource Centers are of a similar model and also heavily partners with Wyoming 211. You're right that currently they are not in all communities. This is one-time funding, and it's being administered through the Wyoming Children's Trust Fund. They have released grant opportunities, and 17 communities have received grants pending final contract execution. And these funds are in combination ARPA and childcare discretionary. So important to note, FRCs really approach the resource and referral from a cradle to grave perspective. And of note, actually, in Hot Springs County, one of the FRC grantees is a senior center, and they're looking to partner with early care and education, oddly enough, so I'm really excited what that might look like. So there's some unique approaches using the FRC funds. So next, on the service categories, volunteering and companionship, this addresses social isolation, loneliness, and the Department of Health Aging Division offers 2 programs, senior companions and foster grandparents, and using general fund. Are there any questions about that? Moving on, these are really about more concrete economic support, such as housing and utilities assistance. I had the opportunity to discuss sort of the infrastructure for housing with the Cheyenne Housing Authority director, and we chose to include this. It is not a state investment here, it's HUD funding, but because housing has come up as such a challenge for this population, we felt like it was important to mention that these programs do have preference for seniors and adults with disabilities, and also just important to note that all HUD programs currently have wait lists. And I believe another committee is tackling the housing topic this interim. From the DFS side, we do manage the Low-Income Energy Assistance Program, which is utilities assistance, helping low-income families and the elderly and disabled with current or unpaid utility bills.
Danielle, I'm just going to ask you, because we received this information, should have been able to read it, just identify the name of the program, and if we have a question on what they do or what they shouldn't do.
Perfect.
Let us ask that, but for the most part, we should be somewhat familiar, just trying to make up for a little bit of lost time.
Great. So this next bucket is Food and Nutrition Services, SNAP, TFAP, the Commodity Supplemental Food Program, which is a meal box for the aging.
Chairman,
Please, Albert.
Mr. Chairman, I'm sorry. You know, on the low-income energy assistance program, wasn't there at one time in the state budget a energy assistance program?
Liep.
And it seemed like we had to carve that out in bad times. Can you've been on APROPS a long time, so
It's,
let me know where that's at.
it's in, Danielle, you can help me here, but that is in a unit of the Department of Family Services and the energy assistance and
Okay.
and that, and I think that we've brought that, I don't know where the funding level is versus what the step one and step two, but I think that was, those are federal funds.
Chairman Larson, yes, these are federal funds.
Yeah, okay.
Okay.
We also just want to acknowledge that food and nutrition assistance programs and services also happen within senior centers, so home-delivered meals are kind of included in that category.
So is there a means test for that, or is it just if you're certain age, you get those meals, or is that vary across the state?
Chairman Larson, I'll ask Jeff to answer that.
Chairman Larson, for the senior center specifically, the nutrition program served under the Older Americans Act, pretty much anybody 60 and older would qualify for those services, outside of the idea that if a senior center was too taxed with the number of individuals seeking services, they could implement a wait list and attempt to serve those most in need.
Okay, thank you. That's helpful.
So that does lead us into supportive services, where you would think about your senior center services in communities, funded through the Older Americans Act, and also general funds through the Wyoming Senior Services Board.
Oh, I'm sorry, Senator Barlow.
Thank you, Mr. Chairman. So just since we're talking about a little bit of senior center services and things, if you're in a county that has multiple communities, there's only one actually authorized senior center per county, et cetera, generally. So oftentimes there are smaller communities within in a county that have want to provide senior services, but they don't have access to the same funding. I don't recall the details. It's been a couple of years since I've looked at this, but I just throw that out there. I happen to live in a community that has a senior services center, and they support where they can, but they can't actually, because the program in a much smaller community is not a authorized, program. They can't actually fund it. They just kind of give supportive type things,
So-
community-wide. So anyway, I just throw that out there.
Yeah, so for example, in Fremont County, you've got a senior center in Lander, Riverton, Du Bois, and Shoshone. So can you kind of address that, Jeff?
Yeah, absolutely. And respect to what Senator Barlow is saying, yes, we do have some limitations in each county. Although I would like to clarify that we do not designate just one senior center in each county. That would only occur if there was only one senior center that actually operated. When our grants go open to the public, we allow any organizations that are providing the types of services that we offer to apply for grant funding under the programs. And just depending on how those organizations are set up would vary county by county. You make a good example in Fremont County. We have 4 primary senior centers and actually a 5th senior center providing nutrition services on the Northern Arapaho
Right.
tribe. In Carbon County is another great example. We have one organization.
But do they all have boards, or is there just one board that governs all of them?
Those 5 entities in Fremont County are all independent entities that we contract with. And so we provide them funding based on a formula distribution for the number of older adults we find in that community.
I think the takeaway here, to Senator Barlow's point, is unless there's changes at the federal or the state level, the pie is the same. Organizations that apply and can be certified to provide those services, it would be allocated based on a funding formula, which might not touch, every center in the same volume of dollars. So I think that's the real governing limitation is what's
So
the
give me an
pie.
example on Fremont County component, tell me.
And Mr. Chairman, I'll ask Jeff to just few bullet point details on what that funding formula looks like when requests for applications go out.
Yeah, absolutely. So we do, you're right, the pie is the same. funding allocation that the state receives from the Administration for Community Living is solely based on the total population of older adults in Wyoming. So that piece of the pie doesn't change year on year. When we open up our grants for application, we do an assessment of how many providers have applied for individuals in that service area, and distribute the funding based on the relative population of older adults that we see in those counties. So in Fremont County, we're essentially splitting the pie 5 ways for individuals that we have there.
Got it. Thank you.
Yeah.
Mr. Chairman, continuing on Wyoming Home Services, are there any questions?
And just to clarify, Wyoming Home Service general funded, and that is providing services by grant and is not in every county. You can correct me if I'm wrong on that. And then the requirements for the use of those funds is really dependent on, varies, I guess I would say, from senior center to senior center. Am I getting that right?
Mr. Chairman, I'd invite Jeff.
That is correct, yeah. The types of services that are available do vary in each county.
But the intent is to help provide services that would keep them in their home and divert them away from long-term care is what I think the argument in favor of supporting that has been across there. The pushback has been for the committee is yes, but the services they provide vary greatly in region to region, and it's not across the state. And maybe one, and we've talked about this since the step 1 and step 2, that maybe we ought to look at doing some similar for state general funds. We talked about this in appropriations. This is what we'd expect you to do. So just some food for thought.
And Mr. Chairman,
Please.
very briefly, those discussions have been unfolding for the last 4 or 5 years about whether, when the state faced revenue declines, whether home services, this aging division program should be cut. It was a cut proposal. The legislature delayed that with a couple of years of one-time funding. It is for this next biennium in the budget. It's worth noting at the legislature's direction, over the past 2 years, we've worked with CMS to design a potential Section 1115 waiver to leverage what could be a modified Wyoming Home Services program that would garner federal match and be a pre-institutional home and community-based services waiver for a higher income, lower acuity population, very similar to the mission of Wyoming Home Services, but with that standardized service array and benefit plan that those individuals would receive. That waiver has been submitted to the feds. It's currently in their orbit for review and approval. We meet with them monthly to answer questions. They have voiced to us they don't anticipate an approval or a denial this calendar year, but potentially in early 2025.
Thank you. Mr. Chairman. Please.
Mr. Chairman, on this particular expenditure, it's very specific, it's down to the dollar. So how is that generated? And then how do
General
we?
funds.
I know it's general fund, but how is the number generated to get there? And as we have an increasing aging population, how, I would assume then the department would say, actually, we have this many people now that are eligible, do you want to increase the funding? How would that go about, how would you go about addressing that issue? And what is it? What is the formula?
Mr. Chairman, Speaker Summers, I'll ask Jeff to address what both eligibility and recent means testing has looked like in Wyoming Home Services, as well as how the funding gets allocated and providers' discretion on when they have an increased volume, what their waitlisting procedures look like.
So I'm going to modify that. I think the question is how do we determine how much we request in the budget? How is that amount calculated? So we've got
Mr. Chairman, that's a
1.8
different question. That amount, that's an easier answer, that this, basically this amount has been our appropriation as long as I've been here. And so we have not, our discussions with the JAC and the legislature over the past 5 years 7 years have only been, are we going to reduce or cut the program altogether? So our budget request has been based on the current service delivery, the current budget for the past 3 or 4 biennia.
And I would just add, Speaker Summers, that there has been some appetite from the Senior Citizen Center to increase that amount. So we just got it fully funded back in the standard budget this year after we'd had the step 1, step 2, and we encouraged them to withhold on asking for an additional till while we got that in this budget. So I think you'll see that conversation maturing.
Okay, so follow up, Mr. Chairman.
Please.
So if we were to have a budget that was based on numbers, real numbers, right, from real people, then I would assume that you would develop something like that to show the Appropriations Committee that this is the need, or this is how we're going to put this money out. This is the population we're serving, the population's increasing or decreasing. So is there some formula that you look at when you do this, or you just take the pie like you do with any of these like waiver programs and you just cut the pie according to the providers?
So, thank you, and Director Johansson, my memory has it that it's based on a grant application, and you take the pie and split it according to that. I think that, and I would suggest and ask for your comments, that this kind of leads to the additional conversation. If we identified what services we expect Wyoming Home Services to provide, then you could calculate what that cost would be based on a population and get a more accurate number, and then divide that per the population that's in a respective county. Is that a reasonable assessment, Director Johansson?
Mr. Chairman, you're accurate in how the money gets allocated, and we can absolutely provide data on the number of clients, waitlist, to get a sense of what that demand is, what the clientele would be that are kind of self-selecting into that service. For me, what's most important is going back to the mission of both the Wyoming Home Services Program and our Medicaid Community Choices Waiver or long-term care waiver, is the goal is to prevent or delay institutionalization. So receiving care in the home or in the community to avoid, nursing home or other facility placements. And we kind of have 2 prongs in which that happens. One, through the Wyoming Home Services Program, much smaller. So again, $2.5 million annual budget, where our Community Choices Waiver, I think, is $70, $80 million annual budget, because you have a full Medicaid benefit, you have a full in-home service, more nursing, personal care, et cetera, where that can be provided under home services, the scale is much lower. So if the legislature is looking to solve the problem of providing services that materially delay or prevent institutionalization, is there a positive impact and effect from Wyoming Home Services? We think so. But comprehensively, this is why we were directed and have applied, designed kind of nuanced waiver programs looking for federal approval that grows the pie with federal match to provide more of those services on a more limited basis than the current Medicaid waiver. But as I mentioned, for a higher income, lower acuity population. Right now, for the Medicaid waiver, you have to qualify for nursing home placement, meaning you need nursing home placement, but we'll provide that in your home and community instead. What we're seeking from the federal government is to lower that acuity threshold slightly, increase the income and asset threshold so that folks who might be pre-institutional could qualify for a more substantial benefit. And we've worked for the last 1.5 years with the senior centers in those discussions of how they would potentially participate, become that provider network if this waiver were approved. And I wish I could sit here today and say that it's ready to go. It's not. It's in the federal government's hands right now for approval and back and forth questions. But we're again, Speaker Summers, we're happy to provide that information on where we see the demand in Wyoming Home Services and the Community Choices Waiver. But for me, it comes down to the state has a pretty clearly defined mission that we want to provide home and community-based services in lieu of, institutional services, which can become necessary down the road. What's the vehicle to do that? This is one. And in fact, if you go back through the history of home services, I think in the 90s is when it was created. This is when home and community-based service waivers in the Medicaid area were starting to develop. So from my, sort of historical review, it seems like the legislature created and funded Wyoming Home Services as this vehicle before and as Medicaid waivers were coming online, both for aging populations and developmental disability populations. And so I think those missions can clearly align, and that's what we're trying to work to design on this relatively small general fund program. Could we grow the pie with federal match and provide a more targeted and enhanced service array to a slightly different population that could both save the state money on institutional placement costs, which Medicaid pays for, and also provide a more longevity in the home for those individuals that might ultimately, end up in a nursing home setting on, financed through Medicaid.
Please.
Mr. Chairman, thank you. I think really just what I need to know is what's the trend in the population? I think we need to understand that going forward.
Danielle, please.
Next is transportation services. We learned a lot about 5310 and 5311 grant programs that not only the senior centers benefit from, but other community partners. Any questions? Vocational rehab, we had a discussion about just wanting to be sure to represent DWS in this scan of agency state-provided services that might support this population. Mental health and substance use treatment. I think you all are well aware of that service availability. And then just of note that vulnerable adults are now a priority population, I think came out of this task force. Special education services, this is really hitting on that high needs youth population that may be vulnerable. So 18 to 21 who are entitled to IDEA services.
So my question, and Dustin, to you on that is when we see a kid, and Elizabeth brought this up a little bit, so you've got a kid on an IEP, he's in special education, he may qualify for support services, but the family, because they're getting the services through special ed, haven't made the application to do that. Is there anything that triggers that a school district to say, in our wait list is currently 4 years, 5 years, Mom, Dad, you ought to really be making this application? Is there any type of coordination that takes place there that we can improve, or if there is, great. If not, can we improve on it?
Yeah, Mr. Chairman, there is no mechanism that triggers that collaborative approach to moving from IDEA requirements to looking at like the Medicaid waiver program for those individuals. It really comes down to the specific case managers, the specific district policies. There's nothing that is there to trigger that, though.
And so, Elizabeth, if I may, there's an evaluation, there's a process that the individual goes through to see if they qualify for waivers. Is there a benefit in trying to better coordinate this?
Mr. Chairman, I believe that there's always a benefit in trying to better coordinate between agencies, absolutely. I think that I would also note that the ICC that Danielle has mentioned several times before has been really beneficial over the past just over a year. I've been sitting on that, and I know that folks from behavioral health, from Department of Education, and from DFS have been really trying to coordinate to ensure that those individuals that we're seeing that have those high needs, if they have a potential diagnosis or if anybody has questions that they might have a potential diagnosis, really getting on that track. I think that for youth that are not DFS involved, I think that that might be a challenging place that we can do some more growth and partnership. It is, the waivers are a voluntary program as well. And so if parents do not, take that initiative, we can definitely provide some more education and support. But if parents don't take that initiative to try to apply for the waivers, that's where we see some, problematic areas as well.
Danielle?
Next, we've hit on the 2 home and community-based waivers already, but are there any questions for Elizabeth on this?
So can I go back, because I think you hit on something importantly, that ICC group really meets as people kind of come in through DFS. That seems to be largely where that conversation takes place. But it seems to me that maybe we could, I'm just thinking and would appreciate maybe some recommendations between Department of Health and Department of Education. Is we have somebody that's on special education IED, that we, as we do this screening and looking at that, maybe just trying to, if we could catch that early, maybe we avoid this panic where what do we do with this emergency placement there? So if maybe we could get some ideas on how we could implement something like that. Go ahead, Danielle, please.
And next is the residential option, so congregate care housing.
I did have a question.
Oh, sorry, go ahead, Representative Summers.
Mr. Chairman, on the community choice waiver, is that pretty widespread? It looked like on the big chart it was widespread. And is there a waiting list on that? And like, does everybody get served that needs to be served? Just a little more information.
Please.
The community choices waiver is statewide. The legislature made the decision in 2013 or 14 to uncap that waiver, so there is no wait list like there is on the developmental disability comprehensive and supports waiver. So it is uncapped. We've seen growth in that and believe that there is, institutional cost offsets there that make it worthwhile. Elizabeth, anything you'd like to add there?
Elizabeth?
Mr. Chairman, Speaker Summers, the only thing that I would add there is that, our waivers are, as Director Johansson said, statewide. But I would just bring your attention back to Danielle's slideshow earlier about the discrepancy in provider availability across the state. We have a relatively limited provider base for our community choices waiver, and we are addressing and trying to utilize several different policy mechanisms to try to grow that provider base and enhance it in alignment with the Department of Health strategic plan. One of those is rate study for community choices waiver to ensure rates are competitive and appropriate. That's going to be occurring later on in this calendar year, early next calendar year. The other two policy levers that we have heard loud and clear and are trying to address for providers and to increase that availability of services is looking at ensuring that provider qualifications are appropriate. There is absolutely need for providers to be licensed to provide services such as skilled nursing or home health. But there are also services that we currently have some provider qualifications that we believe are barriers to having that provider population grow that could really address some needs statewide. And so we're reviewing those provider qualifications. And finally, our service definitions. We know from feedback we've received across the state from the population served and also from our partners who do different needs assessments that the service definitions that we have right now don't quite target what the largest need is across the state. So with the community choices waiver, we are doing a waiver redesign, or excuse me, not redesign, sorry, waiver renewal, correcting my terminology there, that's going to be in effect July 1st of 2026 to try to pull on those policy levers as well with the provider qualifications and the services. So that's how we're currently trying to address some of those, I think it's fair to say, shortcomings in the community choices program to really enhance that service provision and service availability across the state.
Just to follow up on that.
Please.
So, and you kind of mentioned it, but what are the shortcomings? Just give me 2 or 3 of them. And then I understand you're going to be addressing them. So the shortcoming, it appears like the number and the quality of providers. Is that it, or what are your shortcomings?
Elizabeth?
Mr. Chairman, Speaker Summers, I think that one of the shortcomings is the number of providers. Just for contrast, it's not apples to apples, of course, between the DD waivers and community choices waiver. But on community choices, we have less than 100 providers statewide for all of the services. For the DD providers, we have anywhere around 600 plus providers around the state. So there's great need for additional providers and additional choice in services that are being delivered. And I think that the other high priority, and I've worked with, I believe, people that you'll be talking to next task force with things like transportation, and what are the specific services and needs that folks have that have a lack of providers and some systemic challenges to trying to access, what services are available now.
Thank you.
Please.
Chairman Larson, here in this section of categories, the operation of community facilities. You can read the rest of it all the way up to the state hospital. And of note on the crisis beds, group homes, really for that 18 to 21 population, we're not seeing a lot of 18 plus enter those facilities. In the cases where they are served by these congregate care settings, they likely entered before they turned 17 or before they turned 18. And there are exemptions and waivers to allow them to stay on after 18 for program completion.
Up to what, 21?
Chairman Larson, I don't know.
I think
I can get
that
back
sounds right.
to you. Yeah.
But these would be good candidates that would
21.
possibly transition then into a support or comprehensive waiver. So, okay, keep going.
Ombudsman services. This is just a key component of serving our vulnerable adults, and these are administered through the Department of Health. Of course, APS, which I don't think we're any stranger to, so I won't spend time going through this unless there are questions.
I do.
Please, Albert.
Mr. Chairman, thank you. This was a long time ago, this was the pot of money I helped get increased because of a need for like crisis beds in rural communities, when you have a crisis. So my question is the $80,000 meeting the need you have with the other tools that you have available? Are there people slipping through the crack or communities that are just having to try to find, whether it's just trying to find an individual that has an extra bed somewhere to hold people until the courts react?
Chairman Larson, Mr. Speaker, that's a great question. I think that the one-time funds that are available and being used kind of disguise the need a bit. The need is great because we are leaning on temporary funds through ARPA and going through those quite quickly, and those expire at the end of December of 2026 in some cases, as early as this year for others. So I do not believe that the $80,000 a biennium is currently meeting the need, and we'd be happy to discuss with this task force opportunities to submit a supplemental budget should that come out of this task force.
So I think committee or task force members, this really gets to the root of the question we're trying to resolve is this enough money? Well, the question would then be, well, for what services, and what services do we expect to be provided in what communities and how? And once we make that determination, then we assess what the funding requirements of that are. And so I think that Albert's question is a great one, but we've got to be able to answer it based on policy, and that's what are the rudimentary services we'd expect any vulnerable adult to have access to in any community in the state, and then how do we do that? So put on your thinking caps and let's get this refined over the next few months, and this information really helps us to do that, because in this larger spreadsheet that Danielle's prepared for us, you look at all of these services and the number of providers across the state. It shows the more acute the condition of the individual is, the more services are available across the state, but they're in those populated areas. And so then those in the more rural areas, again, in rural Sublette County or rural whatever county, it's a struggle to do that. And so what do we do to remedy that? How do we get that transportation plays into that? So here we are. Okay, Danielle, please.
Just wrapping up with two additional categories, legal assistance and guardianship. And just to note that Wyoming Guardianship Corporation provides guardianship and other case management services for complex cases, and receives funding from both Department of Family Services as well as the Behavioral Health Division.
And the guardianship in DFS right now is through ARPA funds. And just, I think we talked about that previously, that we need to look at that. Okay,
Mr. Chairman.
please.
So, Mr. Chairman, on that, well, we need to look at it. So what does that mean? Do we, I guess, is DFS going to like provide us a matrix or a program or something that we can look at to see what the need is, you know, and what it's being provided for? Because this obviously seems like it is low-hanging fruit if we can get it done, but it's not going to be cheap either.
So I think the assignment there would be, is this funding is good through 2026 to get, is that correct?
Chairman Larson, my information has that contract for guardianship slots for DFS clients ending this September.
This September,
This
through
chunk
this
of ARPA
September.
funding, yes.
So was that a confirmation? Thank you. So better yet, then I think what we need to do as we get ready then for the supplemental budget then would be to say what services, what guardianships did we provide? What problem did we really address by allowing those guardianships through Wyoming Guardianship, through DFS? And then what is the need so that we could get ready for and make that recommendation in the supplemental if the recommendation was that it had value and needed to be funded, and in the supplemental to anticipate that that would be ongoing and to address it accordingly.
Mr. Chairman, I think, you know, as you always say, what's the state's role, right? And where do we cut that off? Clearly, I think this is within the state's role. And as we look at those 1, 2, 3, 4, 5, you know, where does the state's role end going down? But I think it's important for, you know, in order to sell this to the body also, is, you know, what is the state's role generally with the vulnerable adults? I think we have to eventually outline that and try to, because we're going to have limited resources. And so we need to target our resources to the places that are going to do the most good.
Well, and I think, and this is kind of what I think with some of the stuff that Senator Nethercott done with this, is we try to, is probably the most important thing we can do for these vulnerable adults is protect their rights, their properties that they're losing. And this is probably one of the most critical areas to make sure that they have representation before they get exploited. So I think we've been in the process of getting that established, and I think, you know, through the, hopefully, you know, that's what we're asking Danielle, is to try and gather up what we've done thus far with these ARPA dollars and to help us paint that picture a little clearer, right? Okay. All righty. Did we get?
Chairman Larson, that is the end of the document.
Okay.
Mr. Chairman,
Yes.
can I just thank Danielle, Elizabeth, and Jeff for their work over the past several weeks in putting this together? I know it's a menu of what we have and some definitions and counties and a little bit of mapping and for educational purposes, but heavy lift between two agencies. So thanks to the staff for getting that done.
I would just encourage, you know, we're gonna stop this conversation here and move on, but, you know, Danielle's provided us with the, right, with the spreadsheet. And, well, when you get old and can't see, I can't see like you can. But, yeah, I would just encourage you to go through and look at those numbers and seeing how much of those services are in each county, how much, and then look at click on that document that shows all of the population of each county, the age population and where they're doing. And it really sets the table to understand that although Adult Protective Services lies with Department of Family Services, the success there depends on services that the Department of Health is providing. And that is impacted by how we bring these people out of corrections back into the community and maintain them in as they age out. And so, again, then what are the level of services that we would expect these individuals to have access to? How do we coordinate with local governments and nonprofits on the lower acuity level? And then what's the expectations on the higher acuity level? So this, of course, will continue on as we visit in June, and we'll give you a little guidance. But all of you, the spreadsheets, we have a copy for you, and if you haven't, the rest of you probably are good at looking at your computers and deciphering it, but I like to have it all out there. So again, Danielle and Elizabeth and everybody, thank you. It is wonderful to help us paint the scenery and that we're going to have to do. So I'd like to, at this point, go into public comment on the vulnerable adult conversation. If there's anybody here that'd would love to hear from you. What's his last name? Laycock. Mr. Laycock, thank you. Thanks for joining us. Tom.
Mr. Chairman, Tom Laycock, AERP Wyoming. We're a membership organization that covers people age 50 and over. Just very briefly, I'm happy to discuss next meeting around some of the solutions that our older adult transportation subcommittee has put together. Some things we've got open. I also wanted to bring up just very quickly, someone had talked about the Aging and Disability Resource Center. The importance of it is high. We were the 50th state in the nation to actually put one together when we got one a couple years ago. It's important for a couple reasons. First of all, Danielle did a great job putting together data in a way that we can use it. We also did the same thing in what's called the Vital Voices Survey. So we were able to get data back from 700 older adults in the state of Wyoming last summer. We asked them a number of questions, but we found out that nearly 3/4 of Wyoming residents age 45 and over are currently providing care or have provided care in the past to an adult relative or friend. So we asked the next question, in your opinion, how helpful would any of the following types of caregiving supports be? And we gave them 10 different options. Number one was, the top vote getter was simply information about available resources for caregivers in your community, 64%. So that's the biggest thing people are looking for, is just what's out there. In terms of how to use an ADRC, there's a lot of different models. I'll give my story a little bit. I had an aging grandfather in Waterloo, Iowa. I have no idea what exists in Waterloo, Iowa in terms of senior services. I was able to call one phone number, tell them sort of where my grandfather was in terms of his level of acuity, and ask what's available. I was able to get back recommendations, phone numbers, and sort of next steps that you should take to keep him aging in the home longer. And frankly, it kept him in the home an extra 2 years. So that's kind of where 2-on-1 comes in. It's that first step. So that said, I'll happy to sit for questions, but I just wanted to make a pitch for the continued success of 2-on-1.
This is going to be won't you agree thing probably, but this is more of a comment. We talk about what services should we provide to the state to vulnerable adults, right? And there's always this conversation the same way in mental health. Do you do it downstream or upstream? Well, this is like important because we can keep that person from getting to the bad place. And so I think we have to keep that always in mind. It's not just who's the worst of the worst, but how do we start downstream to make sure that people don't get to the worst of the worst. Wouldn't you agree?
Mr. Chairman Larson, Representative Summers, there's not a one of us here who doesn't change the oil in our car, right? And we do that because we know instinctively if we don't, the car's engine will eventually seize up. That's really how we look at, for example, Wyoming Home Services. It's one of these things where I can't tell you how much we're saving. There's been a lot of effort put into what they call diversion calculators. No one's got it right yet. But I can tell you that if you don't change oil in your car, there's going to be a day when it seizes up. I can't tell you what day that is. In similar fashion, I can't tell you what day Matilda in Wheatland would have gone into the nursing home had she not had Wyoming Home Services. And so, yeah, a lot of this prevention really does pay for itself on the back end. The average spend, I believe, for Wyoming Home Services, is just as an example, was it $1,500 per person per year? Whereas, Community Choice, that's that prevention side of it. Whereas once they get into nursing home care, I believe the per member per month for Medicaid is closer to $5,000. So every month that you're able to slow down that slide, you're really ultimately saving money and helping people live where they want to as long as they possibly can. Our Vital Voices survey actually pulled out 87% of those that were surveyed said they want to stay in the home as long as possible. Thank you.
Tom, and so Tom, you'd sent me this, I've got this document that you shared with me on, if you've got that refined, have you got that submitted to LSO yet?
I have not, Mr. Chairman. And as you may be aware, when you're trying to show off some of the sort of innovative programs that happen around the state, you tend to miss one. We found out about one just about a week ago. So give me a little bit of time, we'll get that one in there too.
Yeah, I just as a request as we prepare, because this next meeting comes on us pretty quick, if you wouldn't mind getting that and submit it so that they could get that out to us and we could review it before that June meeting would be appreciated.
Yes, sir, happy to.
Thank you. Okay. Mrs. Butler? You're up. Do you want to, so Alyssa, we're at 11:34. I would like to, if we can get through the pilot program and the treatment court transition before we break, and then we'll come back and look at the statute changes.
Mr. Chairman, I'd be happy to run through that quickly. Let me just share my screen here.
Well, and I'm not trying to share with.
I understand. All right.
The floor is yours.
Thank you, Mr. Chairman. Give me just 1 second.
We had been done sooner, but Director Johansson's hogging up all the time.
He
Danielle,
always,
you didn't.
No, it's usually me, Mr. Chairman.
I was going to leave that alone.
okay, Mr. Chairman, so I know that I wanted to introduce myself. I know we're in a little bit awkward situation here, but my name is Elisa Butler. I'm the State Court Administrator for the Wyoming Judicial Branch, and I will give you a couple of updates. One is on Wyoming's pilot diversion program, and so I'll run through that quickly. You will receive much, much more information on that program when you travel to Gillette in August. And then the second is an update on the transition of treatment courts from the Department of Health to the judicial branch and the work that's been done on that thus far and where we think we're headed in the future. So I will go ahead and start with diversion. And Mr. Chairman, I'd be happy to answer any questions along the way if you have any. So the diversion program, it really started based on the work of Governor Gordon and his initiatives around mental health. And that really gave an opportunity to the judicial branch to take a hard look at its processes and where we were seeing, repeat offenders, people with mental health issues, substance abuse issues, and how we could help rather than running those people through the criminal justice system over and over and over again. And so Chief Justice Fox initiated a group that traveled to Miami, which included folks from the executive branch, from the judicial branch, and from the legislative branch to look at that model that they have there, which is a really robust diversion model in Miami. What we found is it's incredibly useful. It's helpful to those who have substance abuse and serious mental illness, and it diverts them early on rather than going through the criminal justice system, provides them with services instead of putting them in jail. And so, as I said, it's a very, very robust program down there in Miami. They have a lot of resources. We came back and decided we might be able to do a stripped down version here in Wyoming. And so that's what we've been working on over the last little over a year. I think we went to Miami last March, and the diversion pilot program actually was piloted in January of this year. So the purpose behind this diversion program really is to provide services to folks with serious mental illness to prevent them from cycling through the criminal justice system where they don't receive these services. So just moving on through the slides here, what we know is that the population, within the general population, 4% of people suffer from serious mental illness. That is significantly increased when you look at the jail population. So 17% have serious mental illness and 72% have a co-occurring substance use disorder.
72% of that 17%.
Correct. Sorry, Mr. Chairman. So as I said, the purpose of this really is to identify those people early, provide them with services rather than sending them to prison or to jail. We have a treatment court model, and treatment courts are really effective, but they are post-adjudication. So they are farther downstream in the criminal justice system than we would like in a lot of these cases. So this is just a step upstream to identify those folks early, try to get them into services before they are adjudicated in criminal court. So as I mentioned, the pilot program commenced in January of this year. There has been a whole lot of work by a lot of people to get that pilot program off the ground. So we've had a group of folks, including Senator Barlow, who probably knows a lot more about the work that's been done with the diversion program than I, who have continuously met in Campbell County. It included the courts, so the judges there, law enforcement, local law enforcement there, prosecutors, public defenders, and then, of course, behavioral health providers, which are a huge piece of this diversion model. So this is a sequential intercept model, and I think it just provides a good picture of where we're trying to identify and divert these folks. So we are looking to divert them in intercept 1 and 2. So really, as soon as we can out of the gate with law enforcement, as soon as they have an encounter with someone, being able to look at that person, determine if there is a mental health issue, a substance abuse issue, and then trying to get them services early on. And then if that doesn't happen at the law enforcement point, then they come into the court system and can be identified early on there and go through some evaluations to determine if we can divert them to services within that diversion model. So, Mr. Chairman, this is just a little bit of data about the Campbell County Detention Center, and I think it just gives you a good picture of how much we could save by providing services to these people rather than jailing them. And I would just say often we see these folks over and over and over again in the court system and in the jail. So this is not just one-time costs. This is consistent over time. These people will come into the criminal justice system. They will be found guilty. They'll spend a few days, few weeks in jail. They'll be let out, and then we'll see them again very soon thereafter. So just some estimates from the Campbell County Detention Center that at any one time, around 10 individuals with serious mental illness are in jail. The average inmate cost for someone without a serious mental illness is $150 a day, but individuals with a serious mental illness require significantly more services, costing anywhere from $1,300 to $1,600 a day. And so if we can use that money instead to provide them with services in the community and create a situation where they are they're becoming contributing members of society rather than sitting in jail. That is where where it makes the most sense to divert that money. In addition, jail can have unforeseen consequences on folks with serious mental illness. It leads to, it further exacerbates their mental illness much of the time. We're just not helping people by putting them in jail. We would be better served by providing those services early on. And Mr. Chairman, as I mentioned before, I think this diversion program would not have been possible without the governor's effort around behavioral health reform and the efforts of the Department of Health, the Department of Family Services to identify this as a major issue within Wyoming, and us getting on board with that and being able to provide what we can in terms of these folks that we see within the judicial branch. So a little bit more just about the pilot program itself and what we're doing in Campbell County. The pilot program leverages the existing treatment court model to provide the diversion court model. So as I said before, this is just a step upstream. We're currently using the staff that staffs the treatment court in Campbell County. So that staff is also overseeing the diversion court there, working really closely with Judge Paul Phillips there, who is doing a lot of the lift for the diversion program. So this document, and it's very small, I apologize, but it is, if you have it in your materials, it does provide basically a step-by-step workflow of what we're doing within that diversion model from the time that those individuals are identified up until the time that they potentially graduate from that diversion court model. Mr. Chairman, I'd be happy to go through those steps, but as I said, you're going to learn a lot about this in August. So I may just move forward unless anybody has questions. Okay. So this is just the methodology, a quick snapshot of the methodology that is used to identify people who come into the diversion court model and who is qualified. So the selected participants have to be nonviolent misdemeanants. So these are low-level crimes, and they have to suffer from a serious mental illness, including schizophrenia, schizoaffective disorder, major depressive disorder, PTSD, or bipolar disorder. The treatment is individualized, and that is something that we have learned as we've gone through this diversion model, is that group treatment doesn't work very well with this cohort, and so individualized treatment plans are really important. Also, case management is becoming something that we've seen is incredibly important to these folks. These are high needs folks, and so they're really sophisticated case managers, and people who can spend the time is really important.
So who's providing case management in this pilot project?
Mr. Chairman, and I'm going to let Director Johansson jump in here, or Senator Barlow, but I believe a big part of that case management is provided by the treatment court team, and possibly in concert with the VOA.
Okay.
Okay. So in addition, the court supervision of this is that the individuals meet once per month with the judge, and they're contacted twice a month at least. So this is just a diversion court flow. I think it's a good picture of where in the process these people can be identified and diverted. So, with law enforcement, when they're booked at their initial appearance, or even later if their defense counsel identifies them as someone who is suffering from serious mental illness. And then they go through the whole process of a referral. We do assessments with law enforcement initially, and then a more in-depth assessment with the behavioral health provider. If they're admitted into the court, they'll go through the program and receive treatment. And then at graduation, what will happen if they've been charged is those charges will be dismissed and they'll be discharged.
And Elisa, remind me, but the dismissal of those charges is something that we've contemplated that we'll have to make statutory change to allow that to happen at some point, or is it in place now?
Mr. Chairman, I will check to verify, but I believe it's in place, but Senator Barlow looks like he may know.
Thank you, Mr. Chairman. Ms. Butler is correct. It is in place because this is the county attorney has discretion at this. So if they are successful in the program, the county attorney has that discretionary authority now. So there is no, and let's be clear, these are misdemeanor, nonviolent misdemeanors. These are not, an elevated crime. And I'd point out something else, just so if I could, Mr. Chairman. This also includes the municipal court in Campbell County. So this is beyond just circuit court and the district court. This also includes the City of Gillette's municipal court. So it actually was quite an interesting discussion between you start talking about those different jurisdictions. But I think it's, like I said, I'm confident that they understand some of the challenges and it's been dealt with, so.
All pre-adjudication.
Yes, Mr. Chairman, it's all pre-adjudication.
Thank you. I forgot that.
Okay, moving on. Mr. Chairman, we did talk about this, but the goals and objectives, the primary goal really is to help individuals suffering from severe mental illness, basically from recycling through the criminal justice system. As I said, we want to help them become contributing members of society. We do not want to put them in jail. Other benefits that we could see are, alleviating jail overcrowding, easing the strain on the Wyoming State Hospital, and then also easing the burden on the courts themselves. Early observations are here, and I think one of the things that I've heard in having discussions with those who are really involved with this diversion court model is that the individuals that we're encountering in this model require very small caseloads, experienced case managers, individualized treatment plans and interventions because they're high needs. And so it's really important that they have that individual contact with case managers in that individualized plan.
So in this, I guess this question I would have to you or Senator Barlow, either one is this is rolled out and we've started to see an individual or two do this, do they feel that they adequately anticipated the challenges that come, or I mean, was it in line, or did we have to adjust to maybe miscalculate? I'm just curious on that. Eric, how do you?
Mr. Chairman, I think that's probably a better question that would be asked in August when you're in Gillette with Judge Phillips and those folks. But I would say that certainly there's an adjustment, and candidates, I speak with Judge Phillips when I see him often in the community, and they'll say, I thought I had a really good candidate, and it's a voluntary system, first of all, let's be clear, it's voluntary. So they have to understand the consequences of what they're part of, the individual, and then the system has to be able to support them. So I think there's still some adjustments going about expectations, both for the individual and the system that's supporting it. But I think, let's be clear, we've probably only had a small number of people, let's be first, small number of folks, and a couple months under our belts. So there's a lot to learn, and you will have twice as much information in August as we probably do now.
Very good. Thank you.
Thank you, Mr. Chairman.
And Mr. Chairman, some of the next steps that we're working on, obviously, as Senator Barlow mentioned, we're still working to streamline some of that and make sure that we have the correct expectations for the folks who are in this diversion program. And then we've also leveraged a State Justice Institute grant to contract with the National Center for State Courts to provide some technical assistance, and then also to help us create a toolkit that we can use in other locations throughout the state as we look to expand.
Thank you.
And Mr. Chairman, that's all I have for diversion, but I'd be happy to answer any questions.
Any questions,
Mr. Chairman, just-
please?
Mr. Chairman, in the end, will we, and I know this is a horrible thing to ask, but are we going to have like what it would cost per individual? So some assessment of that, and then can we compare that to where other places are doing that, where they have probably more efficiencies based on their size? So are we doing that sort of thing?
Mr. Chairman, Representative Summers, what we are doing is we're trying to leverage as much data as we possibly can as we work through this system. So working with local law enforcement there to determine, kind of being able to determine between the amount that we're spending in services for these folks, how does that relate to the amount that we're spending with the same kinds of folks that are in jail? And so I hope that we're going to have that kind of data. As Senator Barlow said, it's small right now. We haven't had that many people who have gone into the diversion court system. So we'll need more participants to have a better idea of what that'll look like.
Director Johansson?
Thank you, Mr. Chairman. Just to add to that, as Elisa mentioned, the evaluation's tough because we're talking about very low numbers. So you kind of have to model or analyze the counterfactual, what would have happened in these cases. And that's really important because something Elisa mentioned that's obviously very important to us is the strain on the state hospital. So if you imagine the workflow with some of these misdemeanants that have committed low-level crimes but have a clear mental illness, the path that normally follows is a Title VII evaluation that's completed on an outpatient basis. It's usually 30 to 45 days while the client is sitting in jail. On an inpatient evaluation, that wait time is much longer, but most of our evaluations are outpatient. And then let's assume that that evaluation comes back that there is a mental illness, person was not competent at the time of the offense, et cetera. And so the judge has the ability to now order that pretrial detainee to the state hospital, in which kicks off another very long wait period while that client sits in jail. So even one case of diversion, while you can quantify the cost of what the treatment was, what the case management costs were, the judicial branch costs, et cetera, there's a lot of downstream costs that should that workflow have gone in the traditional way would have meant thousands, if not tens of thousands of fixed cost dollars in other systems like the Department of Health. So the local energy around this, it's really nice to see, both with the judiciary, local law enforcement, sheriff, detention center, prosecutors, et cetera, to start this and try it. And as Senator Barlow mentioned, to iron out wrinkles of where do we have treatment gaps that Department of Health and our Behavioral Health Division and our contracted providers can support. As Senator Barlow mentioned, we'll learn a lot over the course of the coming months from the local team that's doing this. But it's worth saying that even one or two cases diverted from what would be a lengthy judicial process in Title VII or the state hospital has major return on investment, but it's usually around fixed costs in other systems. So and that's the same on why this connects so deeply to our behavioral health redesign in these priority populations, is that on the treatment and community-based side, we have fixed costs and infrastructure that are there to support clients. What we're doing is transitioning, who those populations are, where those dollars and resources gets targeted. And this is a really small example, but important example of that.
Go ahead, please.
Mr. Chairman, if there are any other questions, I'll go ahead and jump into treatment courts. Let me just 1 second. Okay. All right, so Mr. Chairman, I'll kind of I think the committee has a pretty good idea of where we're at with treatment courts and how we got here. So, what we know is that treatment courts are really effective. And with the focus on behavioral health and mental health over the last few years, I think it gave the judicial branch an opportunity to collaborate with the executive branch to figure out a way to make, to work on treatment courts and become more involved in that. And so in 2023, during the legislative session, Senate File 23 was passed, which required the transition of treatment courts from the Department of Health to the judicial branch effective July 1st, 2024. So we have been working with the Department of Health pretty collaboratively over the last year and a half to put that transition into place. So as we worked through that transition, one of the things that we did is we put together a treatment court committee made up of 20 different state and local stakeholders. That treatment court committee met monthly to determine how this transition could be done with the least amount of disruption. The committee met monthly with a contractor of the judicial branch called NPC Research. And this company contractor is nationally recognized in the field of treatment courts. And so the treatment court committee highlighted 6 different areas as a roadmap for enhancing treatment courts over time. And so I'm just going to go through those 6 different areas quickly, and we can, again, I'd be happy to answer any questions along the way. The first was to create treatment court standards. And so those treatment court standards would be based on national evidence-based models and would increase accountability, improve data collection, and ensure fidelity to that evidence-based model. Those standards have been adopted and will go into effect on July 1st of this year.
So would that be suggesting that we didn't have treatment court standards previously?
Mr. Chairman, I think that would probably be a question for Director Johansson.
Mr. Chairman, we absolutely had treatment court standards prior, so I think with judiciary oversight of the programs now, it's more of has been a review and an analysis of where could those grow, be strengthened, et cetera, under the transition.
Thank you.
And as I said, those standards will go into effect on July 1st of 24. We will provide a training for those standards on July 10th and 11th. So that's something that we'll be doing for treatment court providers or treatment court coordinators, judges, and people who are part of that treatment court team. The next recommendation was to create a treatment court certification program. So basically, based on those standards, we would certify treatment courts as to whether or not their practices are aligned with those treatment court standards. So this would be, it would allow for a clear objective measurement for us to follow. And the timeline for this originally was to try to get a certification process in place by July 1st of 2025, which would be 1 year after the transition. In talking with NPC Research, it seems that we may go to the next step first, and so I'll talk about that in just a minute. But we're talking about whether or not that should be 25 or 26, that certification process.
So with your certification process, does that mean if they don't comply, they're decertified? And if that's the case, what do we do? Does it just cease to exist in that area till a contractor comes back in as a certified?
Mr. Chairman, I think that will be part of the discussion around what that certification is going to look like. But what I anticipate will happen is if we determine, or if there's a determination that a treatment court has not met the certification standards, they're not certified anymore, then basically we would help them and support them to come to a place where they can be certified again. So I think there would be a time frame to bring them up to where they needed to be. So the third recommendation is that we create a peer review process. So this would allow folks are individuals who work within the treatment courts to go to fellow treatment courts and peer review what's being done in those treatment courts, provide feedback, and create collaborative relationships between the treatment courts statewide. So it would provide a learning process on both sides, increased communication and collaboration between individual treatment courts, and it provides increased assistance from experienced treatment courts to those who maybe are not as experienced. So again, as I mentioned before, the timeline for this originally was 1 year after certification, but we may flip-flop those two depending on basically what makes the most sense over the next year. The fourth area was estate data and case management system. Again, and this is not to imply that this was not in place or isn't in place right now, because it is, but it is something that should be a focus for us moving forward, and that is to create a system for, for getting data and being able to report out on that data and ensuring that the data that we get is accurate. And so things that we'll be working on, obviously, data collection protocols and requirements, and then also data auditing and training for the treatment courts themselves. Additionally, there's a recommendation for providing statewide staffing levels that are able to support the treatment courts statewide. So that's obviously something that we'll be looking at over the next few years. And continued funding to make those treatment courts effective we need to provide ongoing funding to allow them to operate into the future.
So with the transition and with what we've done in this last budget session, were you provided with the staff you needed to supervise treatment courts? Because I think that falls under in your office, right?
Yeah, Mr. Chairman, so we will get one staff position from the Department of Health that will come over in the transition. I anticipate that staff member will do very similar work to what she is doing now. And then one of the things that we are looking at is a more of a management type position to oversee all of the behavioral health initiatives of the branch, which would include diversion and treatment courts. One of the things, Ben Birmingham has really overseen all of our behavioral health initiatives for the branch. He is also our legal counsel. So he wears many hats within our office. And so we did receive 2 positions this last budget session, and we're looking right now at what makes the most sense for those 2 positions.
Okay.
So, Mr. Chairman, this just is, again, an indication of the administrative tasks that are involved with administering the treatment courts. The Department of Health is very familiar with these tasks, and these are all things that have been subsumed within our office or will be subsumed over the next few months. The readiness assessment, really, this just tells us where we're at today. And I think I've mentioned all of these. We have adopted new treatment court standards that will go into effect July 1st. We have one full-time employee ready to transition to our office from the Department of Health. We have, actually, it says funding applications received for next fiscal year. We have received those funding applications and made some decisions on those. And then we will work on contract execution with each of the individual treatment courts that will be executed by July 1st, 24, working on migration of data and data systems, and then just a transfer of institutional knowledge from the Department of Health. I can't stress enough how wonderful the department has been in this transition and how helpful it's been. Really, really eye-opening for our staff to see. So appreciate all the work that's been done by the department in this transition. So, Mr. Chairman, that's all I have on treatment courts, but I'd be happy to answer any questions.
Thank you. Ms. Butler, any questions on treatment courts? Task force members? So I'd like to go to public comment on the diversion project and on treatment courts. If we have anyone here that'd like to make comment on either one of those topics. We are at 12:06, seeing no public comment. We don't have anyone in line, do we? At 12:06, can we be back at 1? Do you want to be
Mr.
back
Chairman.
sooner? Dan, I couldn't hear that. You were mumbling. 1:15.
Mr. Chairman,
Yes,
can I take a brief privilege?
please.
Today's my sister's birthday. I'd like to wish her a happy birthday, and she lives in the panhandle of Texas. If she's watching, which she might be, then God help her and her family, but happy birthday, Annika.
Happy birthday from all of us. We're glad your brother lives here. And Stefan has told me repeatedly what a great uncle he is. And so I think you're very fortunate we love your family and appreciate all that you do for the great state of Wyoming. So happy birthday. And we will, with that in mind, 1:15 it is, Dan.